people kind of dropped their guards and they ended up, behaving as though there's no more a risk of COVID-19. And when we do so and we go all out and start mixing and congregating areas which are overcrowded and with poor ventilation, then the risk arises for the infection numbers again to start rising. So we need to really send the message to all South Africans as we continue to do that everyone must continue to take the precautions because we're still living with the COVID-19. We're not over. So we are continuing to spread this message in all sorts of different media so that people are always alerted to the fact that the infection can still arise even though the numbers would have shown to have gone down and the level of restrictions have reduced to level 1 of a lockdown. Thank you.
Thank you. The second is asked by Honorable Kahube.
Thank you, Deputy Speaker. Minister Mkhize, considering the fact that your department has only managed to vaccinate only 10% of healthcare workers thus far, against the target of 1.2 million is of great concern. We are now in the middle of March, and reports have indicated that the revised target is only at 700,000 vaccinations for healthcare workers in the next several weeks. It's unclear what the delay is and whether it has to do with throttled supply of the vaccine. How does this fare with your own target of vaccinating 40 million South Africans by year end as per your own target, especially considering the fact that phase 2 and phase 3 of the vaccine rollout plan, which will be far more challenging?
Honorable Minister.
Thank you very much, Honorable Member, Honorable Deputy Speaker. The rate of the vaccination of our health workers is limited by the rate at which the flow of the vaccines. At this point, that is still limited because we're still looking at a smaller number of vaccines. We anticipate that the numbers of vaccines will rapidly increase from April, May, June, and therefore we will then be in a position to escalate the numbers of people who get vaccinated. We will do everything in our power to continue to target reaching as many people as possible with a target of over 40 million people by the end of the year. But certainly the fact that there may be delays in the supply of vaccination may impact on the exact numbers of people that would have been successfully vaccinated by the end of the year. We continue to review the situation as the supplies come through. So when all the numbers are announced and therefore we start accelerating in April, we'll be able to relook and revise what the ultimate numbers would have been by the time we get to the end of the year would have been vaccinated. Thank you very much.
Thank you, Honorable Minister. Honorable Chirwa, it's your turn.
Thank you, Deputy Speaker. Minister, your vaccination plans are haphazard at best and downright disgraceful at worst. To this day, it is not clear, and as you're proving even in your response, when will mass vaccinations begin for the remaining of the population? And that's because we don't have vaccines to date. Despite your insistence rhetoric about vaccinating 65% of the population by the end of the year, in your projections, then Minister, can we have the exact date on when you would have ensured that the sufficient number of South Africans are vaccinated to gain herd immunity? How many more waves must we expect as a country to encounter before we reach immunization targets, as per your assertion? Thank you.
Thank you. Honorable Minister.
Thank you very much, Honorable Deputy Speaker and Honorable Member, for the question. Our plans are not haphazard. I think it needs to be understood that whatever plan every country is embarking upon will depend to quite a great extent on the speed of delivery of the vaccines by the manufacturing companies. We're not the only country that's feeling the constraints. Many other countries have the same challenge. However, our target at the moment is to look at as many people of the 40 million must have been vaccinated by the time we get to the end of the year. As I have said earlier, when the numbers of the vaccines are concretized and we are able to predict the whole year, how many vaccines we'll be receiving every month, we'll be able to indicate the exact numbers of people that should be vaccinated on every month. But our target will remain that we vaccinate as many people as possible by the end of the year. Of course, we will revise it as the time goes, depending on where we see the constraints are in the supply of the vaccines. The waves of the infection can never be predicted. It is possible that there may be another wave, as I've indicated earlier, maybe more, but whatever that situation is, other countries are going through the same experience because you cannot predict or even prevent the wave accurately or predict the wave accurately. And so we hope to do as much as possible to save South Africans from being affected by the infection. But for most of this year, the risk of second or any other third or a fourth wave, it can never be excluded. And all the countries, no one can say until the majority of people are vaccinated that we actually are safe from any resurgence of the viral infection. Thank you.
Thank you. The last on this question is asked by Honorable Sheikh Imam.
Thank you, Deputy Speaker. Minister, in your own admission, you will only be able to roll out most vaccines by the end of the year. The third wave is anticipated in about May. Many experts are saying this, including your Command Council. Added to that is the problem that your National Department of Health and SAPRA totally ignore the issue of Ivermectin, which is going quite a distance in assisting and helping prevent COVID-19 in the country, whether we agree with it or not. What rationale is there for you and your department, and what did you advise the Command Council, considering the fact there's a third wave, you have the Easter weekend coming, we move to level 1, there is no compliance whatsoever on the ground at the moment. Is that not a great risk? What is the advice did you give your Command Council? Thank you.
Honorable Minister.
Thank you very much. We have indicated that the vaccination process will take us up towards the end of the year. And this is going to be the situation in all the countries, that they are not likely to be able to feel secure before that time. That is because of the nature of the spread of the infection and the fact that at this point, the infection will continue even when the vaccination has started. So our advice to all the people, to the Command Council, is that we need to insist on people utilizing their masks, covering their nose and mouth, and to use distancing of more than 1.5 meters apart, and also hand washing and hand sanitizing, and avoiding overcrowded and places which are not ventilated. Nothing will help us beyond that on fighting this pandemic. The issue of ivermectin has been discussed, where the SAPRA has actually issued guidelines as to how it can be used, with the doctors taking responsibility for the administration of the product, together with the consequences associated therewith. And therefore, the research that continues to be done has not completely demonstrated that ivermectin can be openly utilized, and so we will keep to the advice of SAPRA as what we have indicated at this point. But nothing will help us as South Africans beyond the use of sanitizers, hand washing, maintaining a distance, and keeping ourselves into places which are well ventilated, and use of masks. We need to insist that whatever else we do, those non-pharmaceutical interventions remain standard way to avoid us getting the infection to resurge for a third or a fourth or whatever wave. That is what we need to focus on. Thank you.
Thank you, Honorable Minister. The next question, which is 64, has been asked by Honorable K.L. Jacobs to the Minister of Health. Minister.
Thank you very much, Honorable Speaker. The Honorable Jacobs question number 64 reads as follows. In view of the government's goal to vaccinate 65% of the adult population of the Republic, amounting to about 40 million persons in order to reach population immunity to be able to manage COVID-19, what progress has been made in the latest round of negotiations with the vaccine manufacturers, and B, what are the projected dates of receipts of the vaccine? The reply is as follows. We have secured 43 million doses in total. Our agreements are currently with Johnson & Johnson as well as with Pfizer. The agreement with Johnson & Johnson is for 11 million doses and 20 million doses from Pfizer. In addition, there's a commitment to procure 12 million doses from COVAX. The delivery schedule of the vaccine from Johnson & Johnson are committed in quarters, not in monthly volumes. In other words, at the moment, all we can tell is that by this quarter, this is likely to be how much we will get. Once we have got the matter refined, we will be in a position to know month by month or even week by week supplies of what they will give us. That helps us with the planning of the vaccination program. For the first quarter until 31st of March, we anticipated 500,000 doses of Johnson & Johnson vaccine as part of the 3B study, as we have indicated. Additionally, we anticipate receiving 600,000 doses from Pfizer. These doses will be allocated to healthcare workers. Now, these doses of that 600,000, about 110,000 of those will have come from COVAX. In quarter 2, April to June, we anticipate receiving 8 million doses, 5 million from Pfizer, 3 million from Johnson & Johnson, and these will be used to complete vaccination for healthcare workers at phase 2. And again, at the moment, we can only talk about it in terms of each quarter. In quarter 3, July to September, we anticipate receiving 11.6 million doses, and that is about 7.6 from Pfizer, 4 from Johnson & Johnson. These doses will be used to complete vaccination for phase 2 and a balance of phase 3. In quarter 4, October to December, we anticipate 11 million doses, 7 million from Pfizer, 4 from Johnson & Johnson. These doses will be used to complete phase 3 group. We have not received the final delivery schedule from COVAX. Additionally, we are in the final stages of closing agreements for the balance of the doses required, which would allow us to roll out vaccine according to our plan. So when we have concluded all the agreements and we have now in a position to do a month-to-month breakdown, we will be able to announce that. And also we will be procuring a bit more vaccine so that we cover more people, as we have indicated. All of those will be indicated when those additional vaccines have been secured. Thank you very much.
Thank you, Minister. Honorable Jacobs, you want to take the first supplementary?
Thank you very much, Chairperson. Minister, thank you very much for your reply. Now, with respect to the envisaged vaccine rollout plan, by when do you expect to have vaccinated the 65% of people who are required to reach population immunity? Thank you very much.
Honorable Minister.
Thank you very much, Honorable Deputy Speaker. We are still targeting many of the vaccines to be administered by the end of the year. As we have indicated, we are mindful of the fact that some of the supplies can be interrupted or can be delayed by the manufacturing companies, and therefore we will be reviewing as we go to see whether that target needs to be altered or not. But in terms of our original plan, we would like to be able to vaccinate as many of those 40 million people as possible by the end of the year. Thank you very much.
Thank you. Honorable Chiro, it's your turn.
Thank you, Deputy Speaker. Minister, over 100,000 vaccines have been administered by the NDOH. Can the minister just appraise us on what the procedure is in relation to the limit of how many vaccination participants can be a part of a clinical trial or a study? And if we have surpassed this mark, noting that the Johnson & Johnson vaccine that's being trialed in South Africa is still a study and not the actualization of the vaccination program. Thank you.
Honorable Minister.
Thank you very much. Let me try and explain this in a simpler way. The Johnson & Johnson vaccine has been studied, and therefore the issue of safety and efficacy have been finalized. What we are doing is what we call an implementation study, which means whoever is going to get the injection with Johnson & Johnson now will not need to get another vaccine at any time in the future. We're done with them. If we are looking at the previous trials that have been done, those studies were the studies that actually put people on either placebo or on the vaccine, which meant therefore that neither of the people would have necessarily known whether they've got a vaccine or a placebo. So that's a very different study. This study that we are embarking upon, we will also be doing when we start with Pfizer, even though we've done all the efficacy and safety studies. It's just to look at what happens after people have been vaccinated. We would need to take up to about 500,000 of those so that we can have a large number of people that can be observed. All that it means is that we will want to know if there are any new breakup infections or breakthrough infections that are arising. Is there anything else that we need to take into account as we vaccinate the large number of people? So it's not the same kind of study. This is a study which we're calling it an implementation study. In other words, we are implementing the vaccination and observing if there are any new lessons to learn from that. We'll do that for the first two vaccines that we'll administer, but the rest of the people are going to be receiving Johnson & Johnson vaccines. There won't be a need to continue beyond 500,000 on each of those studies. So that is the nature of the study. But having said so, we need to be able to say that Johnson & Johnson vaccine is going to be fully produced and in large numbers. When we start the next batch of vaccination in the next phase, we'll not need to continue with the study. We'll just continue with the vaccination, but we'll use lessons that we'll have learned on those who are exposed to a high level of infection as health workers in the hospitals and in the health settings. That is what is going to be happening. So we are quite comfortable that this vaccination is progressing well and that the study will benefit us as we move on in the long term.
That's a point. Thank you very much, Minister.
Deputy Speaker.
Yes, Honourable Member.
I don't think the Minister got the question that I asked. I asked what is the limit of how many vaccinations can be administered according to SAPRA regulations if it is a study that is being administered.
Honourable.
And if we have surpassed that mark as a country.
No, Honourable Minister, you will add that to any answers that are going to follow if you didn't answer it as she says. The Honourable.
I have answered it actually.
Okay, thank you. Yeah. Honourable Sukers.
Thank you, Deputy Speaker. I will just switch my video off because my internet is unstable. Honourable Minister, most leading COVID-19 vaccines have ERC6 fetal stem lines in either the design, development, production, or confirmatory lab test phase. These stem lines have been derived from aborted fetuses. We note that these abortions took place over 50 years ago. Many South Africans have ethical and moral objections to receiving a vaccine that has been developed using these stem cell lines. There are a number of vaccine candidates that have been developed using means that are ethically acceptable. Is the Minister considering acquiring any of these to be rolled out in South Africa? And will our citizens be given a choice over the vaccine they receive? Thank you.
Okay. Honourable Minister.
Thank you very much, Honourable Deputy Chairperson. I must say that I've missed most of what the member has said, but I'll answer to what I would have heard. The honorable member refers to vaccines derived from aborted fetuses and stem cell lines, which are causing ethical issues amongst those who will be receiving them. As far as I am aware, there are two main types of vaccines that we are receiving. One set of vaccines are created from what we call messenger RNA technology, which basically is a form of creating a memory in the human cells to be able to create antibodies against a virus, even if they have not met the virus. So that's the messenger RNA technology that I'm aware of, and I'm not aware of any aborted fetuses being involved. The second one is a group of vaccines that are based on what we call adenovirus vectors. They are generally using two types of adenoviruses. These are the viruses that generally cause flu, or that are found in the common existence of humans. So one of them is adenovirus 5, which then they use that to carry some of the spike protein components to be able to get recognition in the human body. That virus does not have the capacity to replicate and therefore cause a disease in the person. But as soon as it gets into the body reacts to this particular format of the virus and recognizes the aspects of it which are part of the coronavirus structure, and therefore create antibodies to destroy it. The other one is called the adenovirus 26. That one is actually derived from adenovirus that are more common amongst the chimpanzees, and then they then use that, which are harmless to humans, and in the process, that process also creates a similar response from the body. So I have no issue about, I have no knowledge of the aborted fetuses being involved in this case. At the moment, we will be having the one Pfizer vaccine, the other one will be J&J vaccine. So whilst we would want to use as much as what is available for every community, I suppose if there's anyone who's got an issue, they might be able to discuss to say which of those they prefer. That is where we would leave it. But we would really like to encourage South Africans to use what we have available, because they're all safe. And as far as we would be concerned, we're not aware of this ethical issue associated with the vaccine production. Thank you very much.
Thank you very much. Honorable members.
Deputy Chairperson, we could make available to the Minister the research.
Thank you.
Any voluntary action such as you're suggesting is welcome permanently. You don't have to ask. But thank you very much for doing so.
Similarly, Honorable Deputy Chair will accept. We don't have to be asked, we will accept.
The last supplementary question on this matter is asked by Honorable Kwang.
Thank you very much, Deputy Speaker. Minister, it has been widely reported in the media that criminal syndicates are targeting COVID-19 vaccines and related products to entrench their international networks. What measures or steps has the department taken to ensure that vaccine procurement firstly is above board, and measures to try and curb illicit vaccine rollout in the black market, or that might potentially be rolled out in developing economies, especially the African continent? Thank you.
Thank you, and thank you for your brevity, sir. Honorable Minister.
Thank you very much for the question to the honorable member. Indeed, we have noted of late the existence of a report of fake vaccines found in South Africa. This was brought to attention by the South African Police Services, working with some other Interpol police. And in this case, we would like to indicate that it's a very worrying issue. And we have, in our interministerial committee, led by Deputy President, we've got a team that is looking to the issue of dealing with these problems, which means the police are on high alert on this matter. Secondly, our procurement process is to ensure that there is a very short line between the purchaser and the producers. So we're buying directly from the manufacturers, even though there are many people who have offered in between that they would want to sell these vaccines, but because we've got a direct relationship, we're able to do so. That limits the numbers of vaccines that can come through outside the lines that the government would have designated. Then, of course, for the private sector, we have agreed that generally they would access their vaccines via the government procurement process, so that they would therefore be able to get what is assured as good quality vaccines. We would want to encourage our people to be aware that the vaccines are free at the point of the administration, so that we don't have a space for people to be charged for a black market, that would develop as a result of that. So in the rest of the continent, this matter has also been taken up quite seriously, and the governments in those particular countries are working with the manufacturers to try and limit the sourcing of these particular black market vaccines. So we hope that we will be able to, always be a step ahead of the black market and the fake vaccine syndicates. Thank you very much.
Thank you. The next question, 65, has been asked by Honorable D.M. Stock to the Minister of Social Development. Minister?
Thank you very much, Deputy Speaker. With your permission, may I remove? Thank you.
It's allowed.
Thank you very much, Chairperson. Considering the fact that the questions have been distributed to all members, I'm not going to read the question, but I will go straight to the reply. In terms of the provision of Social Assistance Act number 13 of 2004, a temporary disability grant is awarded for a specific period of between 6 to 12 months, after which the grant lapses. As part of our national response measures to limit the impact of the restrictions that were implemented to limit the further spread of COVID-19 virus, the temporary disability grants, which were due to lapse between February to December 2020, were extended to enable clients to receive their payments. The total number of temporary disability grants which were lapsed at the end of December after reinstatements of the vulnerable categories identified is 197,452. Of this number, a total of 809,000 have been booked for assessment as March 2nd, while 85,136 have already undergone assessments. When consideration is given that approximately 80% of the clients who previously received a temporary disability grant will reapply, the target is 157,961. The medical assessment is a prerequisite, Honorable Speaker and members, to the application process in order to ensure compliance to the Social Assistance Act of 2004. Of the 85,136 clients assessed, a total of 75,938 have already completed the application process. And then B, in order to meet the deadline date of 31st March 2020, a number of measures have been implemented, including, and I will not go into explaining each one of them, I'm just going to indicate them. One is staff work extended paid overtime. Two, additional service points have been activated. Additional 7 doctors have been contracted in the Western Cape in particular to assist with the assessments. An additional 64 doctors in the health sector in the Cape Town Metro have received orientation, daily monitoring of progress to facilitate timeless interventions. Despite these measures, there are still concerns, particularly in the Western Cape and Gauteng, about ability to meet the March deadline. Particularly, focus is being placed on these provinces, and I have, Deputy Speaker, directed the CEO of SASSA to provide me with weekly reports, and also in addition, Chairperson, I have also requested that besides the monthly reports, I have also asked them how will I be ensured that these meet the deadline, and I was given an answer today to say that they They will ensure that they get additional support from head office. A daily basis reports, they've requested them to identify blockages so that they can clear those blockages. And lastly, they will have to fast track the supply chain because in many instances, the challenges are with supply chain. I thank you, sir.
Thank you. The first supplementary is by Honorable Stock.
Thank you very much, Honorable Minister, for such a comprehensive response. It's really appreciated. In an effort to ensure that our people receive their grants by the 31st of March 2021, what have the national and provincial progress assessment reports revealed? And in case there are some challenges that I experienced, how have these progress assessment reports assisted in providing the adequate and requisite responses to such challenges? Thank you.
Honorable Minister.
Thank you very much, Deputy Speaker. Firstly, I would like to indicate, and thank you, Honorable Stock, for the question. I want to indicate that from the time that we started in the new administration, and because of the call for the strengthening of the capacity of the state in order for the state to deliver, we are working in a coordinated manner as a portfolio, the Department of Social Development, SASSA, and NDA. And I have taken the responsibility also, Chairperson, of ensuring that the department does take responsibility of oversight that is provided by SASSA and monitor the implementation of policies, while SASSA, on the other hand, is responsible for the execution of the mandate given. Lessons learned which will assist SASSA in delivering better services in the future include the following: the use of virtual assessments where doctors in the health facility are able to conduct assessments from the files and supplement these where necessary, with telephonic interviews where necessary. This will reduce the need for clients to present themselves for a face-to-face assessment. However, this will only work where the Department of Health has a file of the particular client. Implementation of online booking system, which will enable clients with access to the internet to be able to book their assessments from the comfort of their homes. Because, Chairperson, when all is said and done, as a Department of Social Development, we want to bring the services closer to the people. Thirdly, electronic notification and follow-up of clients. A challenge which has been experienced has been clients who have not honored their assessment appointments, who could be better managed through timers, reminders through SMS notification. And fourthly, need for an effective call center. The automated process introduced during this period will not replace the face-to-face channel, which will be required for our clients for some time to come. However,
thank you very much, Honorable Minister. We can continue with your answers indirectly in the process of responding to others coming. The next supplementary question is by Honorable Abrams. No, Aris.
Thank you very much, Deputy Speaker. Minister, the social economic situation in the country now is far worse than it was when the relief measures were introduced. Unemployment has risen. Many households have been left without breadwinners who have succumbed due to COVID. Without government intervention, many people in this country will starve. Does this situation not make a good enough case for the introduction of a basic income grant for all unemployed people in this country? If it does, what engagements have you had with your cabinet colleagues about introducing such a grant?
Honorable Minister.
thank you very much, Deputy Speaker. While, of course, I do accept that this is almost a new question, but I'm prepared to respond to your question. Maybe one would like to indicate that generally the struggle of the poor people of South Africa, but of the world and the continent continues. The advantage that we have in South Africa is the fact that we have a government that cares. We have a government that is thinking ahead even in terms of the question that you are asking with regard to the basic income grant. And what I think is also very important, Honorable Aris, is the fact that tomorrow we are having a debate on the issue of the basic income grant. And I think that it will be quite important for yourself, and I know your approach towards it. We talk to each other in the committee. I would like to not necessarily further explain the proposals on the basic income grant, but to clearly indicate that when we realize the fact that we have a challenge with regard to unemployment, inequality, and poverty, particularly during the period of COVID-19, we were looking at what else can we do despite despite the 350 that had been introduced by President Cyril Ramaphosa. Therefore, the discussion and debate about the basic income grant was very much welcomed in the structures of the African National Congress. And tomorrow when we go to the debate, I'm sure you'll take more interest in it. Thank you, Chair.
Thank you. Honorable Abram.
Thank you, Deputy Speaker. Minister, the 31st of March is certainly not an accurate date to go by, when many TDG clients will only see an assessment doctor in May, possibly June, almost half a year with no grant and no income. This crisis was a making of SASSA due to years of systemic backlog and capacity challenges to get all knowing this all while making the decision not to extend the grant. SASSA's clients, Minister, your clients, have borrowed money in order to survive. They have rent in arrears and they've accumulated debt because of this. Minister, you have previously said that SASSA has not run out of money. So please tell us what motivated the decision to not reimburse grant monies outstanding and owed to these TDG clients since January, and only provide some with a 500 Rand less than half of their grant. Thank you.
Honorable Minister.
Thank you very much, Chairperson. May I, in answering the question, indicate that the same concerns that the honorable member is raising and the same concerns and feel and the felt needs of the people that she is talking about, we feel exactly the same. I wish, Chairperson, that we did not have the kind of budgetary constraints that we have and budgetary constraints that are faced by the entire country. But Chairperson, I also want to indicate that I have answered this question before, that when we talk about SASSA not running out of money, yes, SASSA did not run out of money. The fact of the matter is that we needed to extend, and the new environment, which is COVID-19, put a completely different strain upon us as a department, as well as SASSA itself. But also, Chairperson, I do want to indicate that it's important also for the beneficiaries or the clients, as the member calls them, that they are appraised by SASSA and they are informed by SASSA that they also do need to follow due process, because temporary grants, as it is indicated, is temporary grants. It is not like the other grants where people are assured that their money will come at any moment, whether it's the child grant, the child support grant, or the grant for the elderly. That one is always consistent, but a temporary grant, as it is indicated in the Act, is temporary, and people do have to come back and apply. But I think what is also important is to indicate that when we realized the challenges of COVID-19, we then extended, because we understood that the clients would not be able to come to the SASSA offices. Now that we are at level 1, and now that there's a bit of opening, and Chairperson, I'm also very conscious of the fact that even if we can be at level 1, what the member is raising with regard to people not having the money, I'm very conscious of that. But I also have to follow the law, because I have to be accountable.
Thank you very much. Thank you. Honorable Singh, it's your case.
Thank you, Deputy Speaker. Minister, at the end of December 2020, over 200,000 temporary disability grants were suspended by SASSA at the height of level 3 lockdown with its extended curfews. Many thousands of affected citizens had to queue outside medical facilities, and then present themselves at SASSA offices to renew their grants. Minister, noting that the long queues jeopardize the health and the safety of not only citizens, but also the staff at SASSA offices, it was reported that the suspension was as a result of the suspension of temporary disability grants was due to a lack of funding. And I think that you have somewhat answered this particular question. But it says it was due to a lack of funding, staffing, and other resources at SASSA offices. So can the minister confirm or deny these reports? And you've unfortunately already answered that question. But what are the financial and other interventions that are in place to prevent a repeat of this occurrence? Thank you, Honorable Deputy Speaker.
Honorable Minister, I know you are in meetings where you address the chairperson frequently, and I know those meetings.
My sincere
Go
apologies.
ahead.
Please don't take me to that other chair.
I know,
Thank you very much, Deputy Speaker. My apologies, sincere apologies to you. Yes, I think I have answered the question, but maybe what I could also indicate, Chair, is that, Deputy Speaker, is that we have instructed or we have directed the CEO and the staff of SASSA, the executives of SASSA, to look for other alternative ways of bringing dignity to the people that we are serving. And therefore the issue of the queues, well, maybe let me start from this point that at least we are at level 1, but that doesn't remove the fact that COVID-19 is still with us. And therefore we still have to make sure that the clients, when they come to the offices, they keep the distance, they wash their hands, and they keep their masks. So SASSA is doing its best now to also look for alternative service points which are closer to where people live. And I think that's in another question that I'm going to be answering, that we are looking for alternatives and also using technology to assist us so that people don't have to be traveling these long distances. And by the way, as Deputy Speaker, if I may say, part of what is important for us as a department is to make sure that I speak to my counterparts with regard to issues of transport, issues of human settlement, issues of education, issues of health, because when those are also dealt with, they also make it easy for our clients, including the Department of Health in bringing the clinics closer to the people, because then the assessments can be made even closer so that people don't have to travel the long distances. Thank you, Deputy Speaker.
Thank you very much, Minister. The next question is 86, is asked by Honorable Masan.
Thank you very much, Deputy Speaker. And as I indicated earlier on, I'm not going to read the question, and I'll go straight to the answer. As I indicated in my earlier reply, the temporary disability grants are given for a specific period from between 6 and 12 months. Usually temporary disability grants are lapsed on a monthly basis. However, last year we took a decision to extend the temporary disability grants that were due to lapse between February to December 2020 as part of our national response measures to limit the impact of the restrictions that were implemented and to limit the spread of COVID-19. Grants are budgeted for annually, as I indicated earlier on. The amount allocated for disability grant for 2021 financial year was 24.3 billion. The continued payment of the temporary disability grant costs approximately 1.8 billion. As of March 20, the total number of disability grants was 1.041759. Currently, the number is 934,153. SASSA is implementing a project-based approach to deal with the clients affected by the lapsing of temporary disability grants in December. The project plan is based on a 10-point plan, which covers the following, and I'm not going to read through explaining the following. 1, improved queue management for citizens reporting to the local offices to reapply, booking process for clients, securing additional venues for attending disability applications. Additional 7 doctors have been contracted in the Western Cape, an additional 64 doctors in the health sector in the Western Cape Metro, extended service hours for clients, strengthening partnership with provincial departments of health, payment of social relief of distress, securing additional contracted doctors, the use of electronic tool for tracking assessments booked and completed, maintaining separate days for the other grant type recipients to ensure that all citizens are able to access services. All SASSA offices have dedicated days for applicants for the grants for older persons as well as the child grants. In addition, applications for grants for older persons, foster child grants and child support grants can be lodged online at www.services.sassa.gov.za. I want to also emphasize that clients do not need to report to the offices for these services. Strengthening the call center and the regional help desk to ensure that clients' inquiries are responded to timelessly. And I know that many of the members in the portfolio committee have actually made the calls themselves and found that the turnaround time is very long, and in many instances, people have to wait for a long time. We're working on that, on making sure that the turnaround time is speeded up. Of the baseline of 197,452 cases which were lapsed, a total of 128 clients have already been booked for assessment as of the 2nd of March 2021, while 85,136 have undergone assessments. Of these, 75,938 have already completed the application process. Regular reports are provided to the portfolio committee on progress with the implementation of the project plan for these lapsed grants. I have also directed the CEO of SASSA to provide me with weekly reports so that I don't have to be catching things when things have gone bad. I thank you, Deputy Speaker.
Thank you very much. Honorable B.S. Massa.
Ngiyabonga, Deputy Speaker. Ngqongqoshe uhloniphekile. The temporary disability grant lapsed 2 days after the president announced.
Ma'am, can you speak to the microphone, please?
Yes.
You are speaking away from it. That's better.
Honorable Minister, the temporary disability grant lapsed 2 days after the president announced the return to the adjusted level 3 lockdown. SASSA's reapplication process for the grant has sadly been riddled with delays due to shortage of doctors, shortage of service points, and the fact that SASSA employees are working on a 50% rotational capacity basis. There are applicants who are booked only to see a SASSA doctor in May. With the second COVID wave being harsher than the first one, this meant that people with disabilities ought not to have been exposed to the virus by being subjected to long queues as we saw around the country. Temporary disability grant applicants have been the hardest hit by the COVID-19 lockdown. Due to the haphazard application process, many have been unable to pay for medicines and basic necessities because they have not received grants. Many applicants are unable to work because of their disability. Given these challenges then, Ngqongqoshe, why did the minister not extend the temporary disability grant until April 2021, given that the country is still under the same Disaster Management Act that prompted the initial extension? Ngiyabonga.
Honorable Minister.
Ngiyabonga kakhulu nami, Deputy Speaker, ngibonge nombuzo ovela ku Honorable Minister Masango. Phela ningakhohlwa ukuthi babizwa lokho, so mabebizwa lokho nami kufuneka ngirespect lento ukuthi oh shadow minister. Isithunzi sika minister. Chairperson, futhi angimind nje ukuhamba naye ngoba sisebenzisana kahle mina naye. So isithunzi si right kakhulukazi. Deputy Speaker, amazwi kaNgqongqoshe lo we-DA ahamba lapho nami ngihamba khona ngoba phela if bekuya ngami ngabe nje ngavele ngathi President ngicela ukuthi u-extend nje kube lula ngoba nathi siyathanda ukuthi izinto zibe lula for abantu bethu. Unfortunately for us, nathi sigayidwa i-budget. Nathi kuyafuneka ngaso sonke isikhathi sazi ukuthi noma ngabe siyayifuna le mali, kufuneka sicabange ngabanye. Kufuneka sicabange ngo-NSFAS, kuphi uminister nangu uminister ukhona. Kufuneka sicabange ngo-NSFAS, sicabange nabanye. Sibone ukuthi kodwa le mali le encane ekhona esezandleni zethu siyispreada kanjani ukuze wonke ama-South Africans ayifile i-benefit. Well, it's unfortunate ke ukuthi sikhulume ngo-haphazard we-SASSA because ngokubona kwami uSASSA uyazama impela ukuthi a-responde to ama-needs wabantu. Kodwa ke nami ngiyafuna ukusho ukuthi nami kuba khona isikhathi lapho ngingajabuli khona ngoba sometimes nesikhathi esiningi nginokuhamba ngiye ema-ofisini wawo iSASSA, ngihambe ngiye kuma-service points, ngifike kuma-service points ngithole ukuthi Nkosi yami u-CEO uyafuna ukubona ukuthi izinto zihambe ngale ndlela kodwa zibe zingahambi ngale ndlela. Ngakho-ke ngiyafuna ukusho ukuthi sizowenza konke okusemandleni kwethu ukuthi silalele i-portfolio committee naye u-shadow minister simlalele ngoba esikhathini esiningi ukhuluma into ezwakalayo. Siyabonga.
The next one is Honorable Bilankulu.
Na khensa mutshami wa xitulu.
Bottom.
Muchaviseki Holobye, ni lava ku landzelerisa. Xana hi wahi makungu lawa mi nga na wona lama makunguhateke ku ololoxa xiphiqo lexi mi nga na xona xa ku vona leswaku ma-social worker lama mi nga ma yisa exikolweni tanihi ndzawulo na lava va nga tiyela va hetelela va thoriwile. Ehandle ka ku languta ti-private sectors, xana hi tihi tindhawu kumbe tindzawulo leti mi nga burisanaka na tona ku vona leswaku eku heteleleni swidyondzeki leswi swi kumeka swi ri karhi swi tirha eka mintirho ya minkarhi hinkwayo leswaku va kota ku hlayisa mindyangu ya vona tanihi ndzawulo ya nhlayiseko wa vanhu. Inkomu.
Thank you. Honorable Minister.
Honorable Chairperson, I had to try and understand so that I can also respond in the same way. Unfortunately, hey, kunzima. So, nami ngizozama ukuthi ngiphendule ngesizulu ukuthi uphi yena umember wakho. Oh yeah, no, ngiyabonga kakhulu. Ngiyabonga kakhulu, honorable member we-African National Congress. The department has tried working together with the private sector to some degree, and we are hoping that maybe the private sector izozama ukuthi isincedise la ngoba thina si-department siyawa-trainer ama-social workers. Masiqeda ukuwa-trainer ama-social worker uthola ukuthi asisenayo le mali yokuba qasha bebonke bephelele. Kodwa-ke ama-department ayazama amanye ama-department ukuthi nawo azame ukuwathatha ama-social worker. Okwesibili, siyazi ukuthi ama-province amaningi ikakhulukazi i-Free State iye yazama ngempela ukuthi iwathathe lama-social worker atrainiwe yaze ya-extenda yona ukuthi ibathathe babe permanent. Into esixakile kwakhona manje ukuthi sizame si-department ye-social development ukuthi labo esibafundisile sizame ukuba-absorba ngokwethu si-department. Siphinde sicele namanye ama-department ukuthi nawo enze njalo. Into engifuna ukuyisho also, Honorable Deputy Speaker, ukuthi la eSouth Africa sibona ukuthi ama-social worker ayashoda endaweni eziningi, awamaningi ama-social worker, and yet the social ills ezibhekene ne-South Africa zifuna ukuthi kube nama-social worker amaningi. Kunjalo nje futhi sibona ukuthi amaphoyisa maningi ayasebenza amaphoyisa kodwa esikhathini esiningi afika after the effect. So into esifuna ukuyenza ukuthi sikhulumisane namanye ama-department sizame ukuthi si-extend ukuthi South Africa ibe nama-social worker amaningi njengoba sinamaphoyisa amaningi, sinonesi abaningi, nama-social worker kufuneka kanjalo sithole imali ukuthi baqashwe so that sizoba nabo from street to street, community to community. Thank you.
All right. Thank you very much. Akhbar Breed.
Thank you, Chairperson. Minister, we have seen SASSA and the department scurry to get processes into place to assist the most vulnerable of the most vulnerable because of this lapsing. Minister, when did you first become aware of the fact that Treasury would not be able to provide extra money to cover an extension and the government thus failing the people once more whilst there is not enough doctors to conduct the necessary assessments? Is this a lacking of timeous planning by your department? I thank you.
Honorable Minister.
Thank you very much, Chairperson. I would like to go back to the fact that had it also not been for the challenge of COVID-19, we would have not been in the situation we're in today. Unfortunately, the honorable member sits in the committee, or sometimes sits in the committee, but I guess she follows what goes on in the committee. But I understand you can't expect the member to be in all committees. There are just a few, so I appreciate that. But what I think is very important is to indicate, Chairperson, that this government of the African National Congress, through its executive, we do have annual plans, and the annual plans are presented to the Portfolio Committee. We do have annual plans which also are presented by ourselves to Cabinet, and therefore that we do not have a plan or we did not plan ahead. None of us were able to plan ahead for COVID-19. It completely caught us unaware, but I must say that despite the fact that it caught us unaware, we were able to immediately put ourselves together and plan through the national structures, which was the presidential NCCC, but also we had our own structures at a departmental level that brought the two agencies plus SASSA to plan ahead, also being informed by what was coming out of the Cabinet, what was coming out of the NCCC, what was coming out of the net joints, because those were structures that were feeding us with the necessary information in order for us to adjust our plans. We adjusted our plans accordingly, and we adjusted our budget accordingly. Thank you, Deputy Speaker.
Thank you very much. Honorable Liz van der Merwe.
Dankie, achtbare adjunct speaker. Can you hear me?
Yeah.
Thank you. Honourable Minister, I just wanted to inform you that I did try and phone your provincial call centres again this morning, and I wish to report to you that those provincial call centres are not working. In fact, only the Western Cape's call centre is working. And so when we speak on the one hand of an acknowledgement that SASSA clients cannot travel long distances, on the other hand, these call centres are not available to them. And I think that is totally unacceptable. That being said, one of the reasons why you could not extend the disability grant for the period of the review is because you simply did not have the cash, and you've admitted to that. But most disturbingly, Minister, SASSA continues to bleed millions per year through fraud, corruption, and illegal deductions from grant recipients. In fact, over the past 5 years, more than 282 million have been looted from SASSA coffers, and each day we are confronted by stories of officials, syndicates, police officers, and other fraudsters stealing from SASSA. This money could have been spent towards this temporary disability grant. So my question to you, Honourable Minister, can you tell us what you've done since taking office in 2019 to ensure that you clamp down on the wide-scale theft of money from SASSA meant for the poor and vulnerable, And can you list your successes in this regard? Thank you, Honourable Minister.
The Honourable Minister.
Thank you very much, Chairperson, now at least. Well, Honourable Member, I have indicated already as I was speaking that I personally am not happy with the call centers and the fact that not all the call centers are working the same way. And I do want to say that I've made the calls myself too, and I've indicated to the CEO that I've made the calls and I've been confronted with calls that are delayed, calls that are take too long. And I'm not happy about that. I cannot deny that. And I'm going to do everything I can to make sure that the call centers, because South Africa is well experienced in terms of the technology of call centers. And that's the reason why I'm saying to SASSA, if the call centers in the provinces where they are not working, we must then just change and make sure that we get the service providers whose call centers are going to be able to serve the people of South Africa. So that is work in progress, and I accept. I'm not happy with it personally, and I think SASSA is doing whatever it needs, whatever it takes for them to change that. With regard to my successes, I just want to say to the Honourable Member, yes, I have an oversight over the entire department. I have an oversight over SASSA and NDA. However, successes that come out of there, they're not just success of me as a minister, because there is an administration that I have to keep on pushing, that I have to keep on driving. There's an administration that sometimes gives me sleepless nights. I have to hold them accountable. I have to go to the places to make sure that things are working. But what I think is a success for social development in general is the fact that we have continued to service our people broadly, despite the challenges when it comes to issues of the 350, the issues of the temporary disability grants. I want to say to the member and honorable members, sometimes it is very important for us to look at the broader picture of what the department is about and what the department does, rather than narrow to the ones. And I do appreciate you narrow it to those because you want to see excellence, even where people are not being served properly. So I can say, in as far as the department is concerned, with the broader expectations by our people, we have served our people. And the success that I can talk about is not about me, it is about the success that you see of the number of 350 we've paid, the success that you see when it comes to the child support grant that is given, the success that you see when it comes to all the grants being delivered to our people and delivered on time. I thank you.
Thank you, Honourable Minister. Honourable members, we will now proceed to question 106 that has been asked by the Honourable Aris to the Minister of Social Development. The Honourable Minister.
Thank you very much, Chair. Again, I will not read the question because I take it that all members have the question. And of course, to some degree, I answered it, but I think it's my responsibility to go back to it again, being held accountable by Honorable Aris. According to our records, the overall number of unemployed social work graduates are approximately 8,873. And I'm doing this also, Chair, because I need to clarify this issue of the social workers, because the numbers keep on flip-flopping. But I need to put the numbers as they are, as they are from the department. Of this number, 4,829 were funded by the department, while the remaining 4,044 were self-funded or funded through other means. Indeed, we are the first to acknowledge that we have a very high number of unemployed social work graduates. This is a serious concern in light of the prevailing socio-economic challenges and social ills that are confronting our country. Chairperson, I've always held a view that we are sometimes very reactive in terms of our interventions as a country, and the reasons we have more police officers and continue to employ more police officers than social workers is an anomaly and an indicative of us being reactive. And I don't want to be misunderstood to be saying that we don't have to hire those policemen and women in blue. I'm not saying that, but I'm just saying that it's important for us to keep a balance. It is important to highlight that we have actually recorded some progress to address this situation, but more still needs to be done. There is a Chinese saying that with every crisis, there is an opportunity. With the advent of COVID-19 pandemic, we absorbed a significant number of social work graduates to render psychosocial support. Last year, we employed approximately 1,300 social workers in contract for a period of 3 months, commencing June 2020 to 1st July 2020. To provide psychosocial support to our people, the National Treasury granted 33 million to the department to contract employment of social workers. Following the expiry of the 3 months contract, the Presidential Employment Intervention expenditure was evaluated and an amount of 75.978 million was made available to sustain the employment of these graduates until 31st March 2021. We must commend provinces, as I indicated earlier on, like the Free State, who have decided to absorb these workers permanently, and we call on other provinces to do exactly the same. We are in consultation with sector departments such as the Department of Basic Education, SAPS, Correctional Services, Defense and Home Affairs, to establish how many graduates they can absorb to date, and the potential to absorb more social workers going forward. The ability of the provincial departments to absorb graduates due to vacancies arising from natural attrition is monitored and reported on a regular basis within the DSD structures. In addition, part of the plan is to engage DSD entities to determine how they can utilize social workers within their portfolio and realize their mandate. This is part of the plan to expand the base for absorption of graduates. We'll soon engage with the Health and Welfare Sector, Education and Training Authority, as well as African Council for Social Service Professionals, to establish how they can assist through the appointment of interns, both within their organizations and for the sectors as well. I can confirm that HWCTA has placed approximately 1,000 interns in all provinces for work experience for a period of 2 years. These placements have been fully funded by Welfare Sector Education and Training Authority. And as part of expediting the implementation of the Presidential 5-Point Plan and the National Strategic Plan on Gender-Based Violence and Femicide, we have employed an addition of 200 permanent social workers across all provinces to focus specifically on the scourge of gender-based violence and femicide. This is in addition to what we already have in the area. Thank you.
Thank you, Honourable Minister. The Honourable Aris.
Thank you very much. Minister, the inability of your department to absorb trained social workers who are desperately needed in society is a perennial problem, and we worry that your next move will be stop the funding of social work and students altogether, which would have a harmful effect on the lives of many. What intervention have you made to link the training of social worker students with future job opportunities? And are you in any way considering defunding bursaries for social work students? If so, why?
The Honourable Minister.
Thank you very much, Chairperson and Honourable Aris. The inability to absorb social workers really most of the time has something to do with availing budget and being able to have the money to do so. And I think that in our time in the 6th administration, we have really tried our best, as I am indicating in my answer, that we are looking for other options. We are trying to make sure that other departments and other structures, including the private sector, can be able to absorb these social workers. Now, with regard to the funding, I think that the overall funding, not only of social workers, but of most professions in South Africa, goes through very difficult moments, especially at this time when now we are being faced with COVID-19, and therefore the monies that are supposed to be collected, for instance, by Treasury, they are unable to collect as much, and Treasury itself has given us this cuts across the board. So it means we just need to have to find creative ways of doing it, because we can't print the money, we can't write the money. So as I indicated in my answer earlier, those are the other organizations that we are trying to engage to make sure that they can be able to assist us. We don't like what is happening, to be frank and honest with you, but we will do everything we can to make sure that we try and improve it. Thank you, Chair.
Thank you, Honourable Minister. The next follow-up question is to be asked by the Honourable Gungubele.
Thank you, Honourable Minister, for the exercise you've been executing with honor today. My little follow-up or supplementary question, which quite a number of aspects you seem to have, to an extent, addressed it, is regarding the 10-point plan, to the extent that it's intervening in addressing the issues of, amongst other challenging, the queues, the concentration that threatens with COVID, the frustration to the elderly, indignity, women, crime, and so on, from the point of 10-point plan. How to this extent is this assisting? Thank you.
The Honourable Minister.
Thank you very much, Honourable Member Gungubele. We had to look for new ways of doing things. We had to use the experience that we are seeing or experiencing, and not seeing, experiencing on the ground, for us to come up with a 10-point plan. But the basis in the main for the 10-point plan is for us to change the way we've been doing things. It is for us to respond to the needs of our people using available technology, using available means which are different from what we used to do before. And therefore, the 10-point plan, which, by the way, we presented to the portfolio committee, and the portfolio committee accepted it only on the basis that they will see the action on each and every one of those 10 points. And actually, the 10-point plan, if I may say, it's covering almost all the areas of the questions that were raised by honorable members today. What I can promise, what I can say, not only to answering the question, but to the people of South Africa, is that my responsibility is to make sure that that 10-point plan, which is meant to assist in reducing the queues, in reducing, and in short, in fact, bringing dignity to our people, is something that I have to make sure that it happens. And on top of that, honorable member, is that other areas of the 10-point plan are supposed to be done by other spheres of government, number one, but also other departments. And in fact, the payment of the social grants at the post office becomes one of the areas that needs our focus, because many of our people go to the post office, they stand in long queues. When they go to the counter, they are told that the money is finished. But we are in a very strong conversation with Minister Stella Ndabeni-Abrahams to make sure that we turn that around. Thank you, Chair.
Thank you, Honourable Minister. The third supplementary question will be asked by the Honourable Opperman, who's on the virtual platform. The Honourable Opperman.
Thank you, Chair. Minister, 3,465 of the unemployed 9,000 social workers have been hired by the department. Last year, the Deputy Minister said that Cabinet had affirmed that social workers should be appointed by all departments. Did this happen? If not, why not? If yes, which departments employed some of the 5,500 remaining social workers without jobs while the country currently desperately needs social psycho support? Thank you.
Honorable members, I want to remind you that in terms of the rules of the National Assembly, a follow-up question will only consist of one question and not multiple questions. The Honorable Minister.
Thank you very much, Chairperson and Honorable Man. Thank you for your question. I think to a very large extent, I have answered part of the other questions that you are referring to. But also, I am not able to immediately give you the number of social workers that have been absorbed by other departments. That is it's not where it's supposed to be, but we do understand that departments also are under stress and strain. If I may, Chairperson, I would request that I get that information specifically of which departments have absorbed social workers and how many of the social workers have been absorbed. Thank you.
Thank you, Honorable Minister. The last supplementary question will be asked by the Honorable Sukas, who's also on the virtual platform. The Honorable Sukas.
Thank you, Chair. Honorable Minister, COVID-19 has worsened school dropout in poor communities across the country and especially in the Western Cape. We urgently need skilled social workers to ensure that learners who are recipients of social grants and have dropped out of school return to school. Given that the department faces budget constraints, will the minister consider redeploying managerial and supervisory staff to client-facing positions to ensure that learners receive the support they need, and to think of using community organization structures and workers such as pastors to develop and implement plans to assist the department with this?
The Honorable Minister.
Thank you very much, Honorable Sukas. And I think that you are actually making proposals that should be considered by the department. But at the same time, I do want to say that we also are under stress and strain, both as a department and SASSA, because we are not operating at full capacity because of COVID-19. And therefore the use of community workers and other organizations, NPOs and NGOs would be very welcome. But I must say that we are already doing that, but almost everyone is under the same constraint of COVID-19. Of course, we do not want to see any of the children in particular who are coming out of vulnerable communities dropping out of school, because you know what that means. Dropping out of school, it means those that have will always remain in the school, and those that are in poor communities will be in a worse situation. And in another 10 years, that's when we're going to feel the impact of those children that have not been able to go to school. So as a department, we will do everything we can. And I hear you also making even the proposal for us as a department to actually go down on the ground and be able to talk to the community workers. I do want to say, Chairperson, though, that with the NPOs that we support, this government and this department, this year, for instance, is going to be spending almost 8 billion rands on supporting NPOs. And therefore, NPOs are almost like an extension of government. We want to see the impact of the amount of money that we are spending, and those NPOs that are related to issues of education will have to zoom into them and make sure that the money that they are given is money that we can see the impact and effect of on the ground. Thank you, Chair.
Thank you, Honorable Minister. Honorable members, we will now proceed to question number 66. That has been asked by the Honorable Siabi to the Minister of Sport, Arts, Culture. The Honorable Minister will answer the question through the virtual platform. The Honorable Minister.
Thank you very much, Chair. I'm experiencing poor network signal here, so my camera is not on. and responding to the question from the honorable member, in dealing with the challenges, the dire circumstances thrown out by the outbreak of COVID-19, we developed a response that was implemented in 3 phases. The first phase saw a number of beneficiaries at 4,166, totaling the amount of 80 million rands plus. Now, this number will go up about 3.4 million as payment for those awarded for their digitization project are paid in the second. The second phase of beneficiaries saw 687 benefiting, with 452 already paid and balance awaiting documentation and confirmation that there is no double dipping. Total amount paid there is 3 million rands. The third phase is still in progress. However, an amount of 70 million rands has been set aside. 6,000 applicants have been received so far and are being processed. We also had, we mobilized partnerships. We work with the Department of Small Business Development, where 197 individuals benefited and 257 organizations benefited to the amount of 11 million rands. We have entered also into partnership with the Solidarity Fund, which saw beneficiaries to date stand at 6,928 with the amount of 4.8 million rands. The Presidential Economic Stimulus Package, apart from these main ones, the department is also implementing a number of PESP projects in the creative and sporting sector, which has so far generated 121 jobs in the area of banking arts through Art Bank, public art, national audit of statues, digitization of library and archived records, and COVID-19 return to play compliance monitoring. The budget here is 165 million rands out of the total allocation of 665 million rands. The National Arts Council total allocation is 300 million. The National Video Foundation is 140 million, and Sport Trust 60 million rand. In assessing the applications received from the sport and recreation bodies, the following emerged as critical areas of need: job retention, organizational functionality, priority special projects, and programs. The department resolved to embark on the implementation of the sector stabilization intervention due to continuing impact of COVID-19 pandemic. We also have established the ministerial advisory team in this very period of COVID-19. At a macro level, the department availed 112 million rands in the form of grants to over 60 national sport federations based on the priorities they identified in their applications, taking into consideration the prevailing circumstances due to restriction instituted to curb the spread of COVID-19 pandemic. Thank you, Chair.
Thank you, Honourable Minister. The first supplementary question will be asked by the Honourable Siabe.
Thank you, Honourable Chair. And thanks, Honourable Minister, for the answer. I think Honourable Chair will agree with me that we must popularize Kwabega. Honourable Minister, in addressing the persistent sustainability challenges exposed by the pandemic, how is your department planning to address the critical areas identified by sport and recreation bodies, the sustainability challenges that have affected the arts, culture, and heritage sectors? Thank you, Chair.
Thank you, Honourable Member. The Honourable Minister.
Thanks, Chair, and thanks, Honourable Siabe. we will actually popularize Gqeberha and many other areas, as you suggest, which are being transformed. But Chair, coming to the question, which has been asked by the member, Honorable Siabi, within the final budget of the department, we've seen that it is important going forward to strengthen the sustainable support for the portfolio, both from the financial and non-financial points. From the non-financial point, focuses on human capital development through construction and support of centers for excellence like academies for athletes and artists in order to professionalize the entire portfolio. I know, Chair, that this would cumulatively do away with the total dependence on grants by the sector to government. On the issue of financial support, the Mzansi Golden Economy and grants in sport need to be looked into, as I said, within the budget which we have. Two, the issue of infrastructure development for the proliferation of spaces for creative as well as sporting activities is very important. And we know, Chair, that in this instance, in many cases, we are let down by our own local spheres of government because we transfer grants there. These are the people who are supposed to be constructing these facilities, but in some instances, that is not happening. The other lesson we learned is that the 4IR has imposed itself within the sectors under our care. Going forward, we'll look into ways of assisting our constituency on this to further ensure that maximum human capital development is achieved. The last point I want to point out as a lesson here is that issues of comprehensive and strategic wellness intervention to deal with the challenges of depression, of lifestyle, abuse of substances, financial challenges, legal challenges, and so on, becomes critical. And we have seen that this period has exposed both the athletes and the artists to these vices. And therefore, we want to concentrate and ensure that we deal with the plight of the athletes and artists in this particular area. Thank you.
Thank you, Honourable Minister. The next follow-up question will go to Honourable Van Dyk.
Thank you, Chair. I will also not use my video due to poor signal. Minister, there's an outcry of artists in the public domain participating in a stage sitting at the National Arts Council because they do not receive their funding as proposed per their contracts. Instead, the NAC has gone back on its commitment and contracts have been changed to give artists only half of the original commitment. Minister, in your view, besides whether this is fair, what are the legal implications of this turnaround? If it's not legal, who will foot the bill for possible legal steps taken by artists? And how will the DIC support artists in this regard? Because they too may face legal actions against them for not honouring their contracts with artists in the industry who they appointed for projects as intended by the Presidential Economic Stimulus Programme. Thank you.
The Honourable Minister.
Well, thank you, Honourable Member, Honourable Van Dyk, with that question. The challenge of the National Arts Council has been widely communicated. And this relates to the Presidential Economic Stimulus Package that when, as I've indicated here, that the NAC was provided 300 million facility to assist the artists. And right from the beginning, they then committed 600 millions, meaning 300 or 100% more. Now, the board is dealing with that situation. And part of the reason cited why they had to come and act against the NAC staff, where they suspended with immediate effect, the CEO, the CFO, and in fact, the CEO and CFO, so that they continue with the process trying to...
You know how difficult it is to do the thing?
Sorry?
Honorable Minister.
Yes, Chair.
Seems to be the Undersecretary somewhere.
I've got
Reply.
to do a lot of other things.
Can you move that Undersecretary, please?
Oh,
and
okay.
allow the Honorable Minister to continue with his reply to the question.
No, thank you, Chair. So I think that what the artists, especially those who are still waiting to be compensated, are not going to get fully what they would have expected. And there are implications, as the Honorable Member is saying, besides the fact that it's unfair to the artist, but also it does have legal implications. As I said, this was beyond the control of the council. All what they are doing is to intervene, and they've committed themselves, which they've started, to inform the public on a continuous basis so that everybody is on board in what is happening within the NAC. Thank you very much, Chair.
Thank you, Honourable Minister. This third supplementary question will be asked by the Honourable Madlinkosi from the Chamber. Honourable Madlinkosi.
Thank you, Chair. Mr. Minister, with all the numbers you've mentioned, they don't make sense. They don't reflect what is happening right now on the ground. Your department has been the most lethargic in terms of providing support to artists during this very difficult time. You have made no intervention to ensure that some reprocesses royalties to artists, and many artists do not know what happened to the relief measures you announced last year. And with this Payola thing happening, and it is ripe with the SABC, artists are picketing right now. And of the entire arts sector, what percentage do you think what percentage do you think those that you supported constitute? Thank you.
The Honourable Minister.
Thank you very much, Chair, and thanks to the Honourable Madlingozi. Firstly, Chair, we have said what the department, the Honourable Member, just have to know, which I think he does, know the strength of the department in terms of its budget. I think that, Chair, right from the beginning, we sprang to action as the department and looked at the plight of both the artists and athletes as we continue now, as we're talking about the third phase. How many, what percentage in the first instance? The area of creatives in this country is not regulated. No one can stand up and say there are so many artists in South Africa. What you see are the organization representing artists, but there are others who are outside of that. So the interventions are not nothing, do not mean nothing, as the member is saying. Actually, that's the narrative which is always going to be disputed by the facts as we've put them here. Now, the issue, I think Honourable Member is conflating issues. The issue about what is happening in terms of COVID-19 and short-term interventions, which is what the relief funds are about, is one thing. The broader issues of transformation of the industry, including royalties, is another. And that part, which is pointing to us, actually reside with yourselves as Parliament, because it's you who must fast track both the copyright amendment bill and the performance protection. And we hope that you, as honourable members in Parliament, will fast track this process so that all the kind of things we are talking about, be they payola or whatever, which by the way, it's correct for artists to demand and fight for such measures which are robbing them their hard-won labor, as it were. So they are correct to do that, but we also, as Parliament, have to do our task and ensure that we meet our sector halfway. Thank you very much.
The last supplementary question will be asked by the Honourable Lutuli through the virtual platform. The Honourable Lutuli. Is the Honourable Lutuli there?
Honourable Chairperson.
Please proceed, Honourable Singh.
Yeah, thank you. He seems to be having connectivity problems. Minister, I'll ask this question on behalf of Honourable Lutuli. Given the challenges that most athletes faced during the early parts of the pandemic, which affected their progress, as they were unable to compete and lost income due to athletics meetings they could not train due to the closure of stadiums, they had no sponsors and no money for supplements and never actually received the COVID-19 relief at all. What will the minister do, or has he been engaged in any talks regarding altering the Olympic qualifying standards for our athletes? Because many of them would not have been able to participate in athletic events to qualify for the Olympics. Thank you.
The Honourable Minister.
Thank you very much, Honourable Chair, and to Honourable Lutuli and Honourable Singh on the question. It's a very difficult situation, Honourable Member, which we are faced with as a country, but also the continent and the world is grappling with that. We looking at what is it that could be done, even if it means that people are working and they are training without their fans, which has been open over a period of time, hoping that as and when they have to go to the Olympics, they have done their part in training, but quite clearly, it is going to be one of the challenges we are faced with because things have not been open for, particularly as you say, for athletes to ready themselves, prepare themselves thoroughly, but they continue to do that within the confines of the COVID-19 pandemic. Thank you very much, Chair.
Thank you, Honourable Minister. Honourable members, we will now proceed to question number 8 that has been asked by the Honourable Ngumalo to the Minister of Higher Education, Science and Innovation. I now recognize the Honourable Minister.
Thank you very much, Honorable House Chair. I just wish to state upfront that the National Student Financial Aid Scheme has not taken any decision not to fund first-year nursing and teaching students in institutions of higher learning. The circular that was sent by NSFAS on the 12th of February 2021 was to remind universities, it wasn't even meant as a public communique, but just to remind universities not to register new students on the phased out legacy qualifications in 2021, as those, because they are phased out, are no longer going to be funded by NSFAS. And also students, though, who are already enrolled in those qualifications will continue to be funded if they are already in the system until they complete. As from the 2020 academic year, universities were required to register first-time entering students on the new qualifications which are aligned to the higher education qualifications framework. For instance, what used to be called BCare has been phased out. It's now called Bachelor of Nursing, which will still continue to fund as NSFAS. The old Bachelor of Education was at NQF level 8. It's been phased out. There is a new Bachelor of Education, which is at NQF level 7, which we will continue to fund, and it's serving the same purpose. NSFAS funds approved programs, including engineering programs at universities,
which must all be undergraduate whole qualifications. That is either degree, diploma, or higher certificate offered by a public university and accredited by the Council on Higher Education are being supported. These will be programs approved by the Department of Higher Education and Training and may be offered by the university provided that the program is registered on the National Qualifications Framework by the South African Qualifications Authority, SAQA. Thank you, Chair.
Thank you, Honourable Minister. Omar Mumalu.
I don't know whether I'm visible or audible. Thank you, Chair.
You are visible and audible.
When one respects the comment by the Honourable Minister, and we want to start by sending condolences to the family and friends of the person who has just been shot by our police in Vaal University with regards to a protest that the students are demanding what is rightfully theirs. But let me just run on to immediately go to the question, which is the follow-up, which goes to the say that following up the South African Human Rights Commission, Honorable Chair and Minister, has allegedly received multiple complaints from the students of whose NSFAS funding applications have been rejected, citing lack of user-friendly and shortcomings of NSFAS. Are you aware of the complaints? And if yes, what are the plans of your department to assist these students with remedial issues that they have raised? And if not, what would be the guidelines of communication in the department and the Chapter 9 institutions in terms of addressing this? Because the reality is that our students are suffering in the hands of your leadership, in the hands of those who are running institutions of higher learning. They're not getting any form of assistance, and there's no hope that they'll get any form of assistance under your leadership. Hence, you would see that every year, during this time of registration, students are suffering in their strikes, but your department has done absolutely nothing to address this. And it's not only that, all institutions, you must anticipate this protest next week, this week, and the other following weeks, that people who are beneficiaries of NSFAS are not getting any form of assistance on your department. And you have been a minister for quite some time now, but it seems that we are not being able to respond effectively to the issues that are raised by our students and the issues that are raised by NSFAS beneficiaries. It seems that, Honorable Minister, your helm at this department is coming very, one might be even tempted to say that you are incompetent to run the department, because every year, every academic year, even during semester sessions, even during annual sessions, none of the students are getting benefit from your office. So you must make interventions. We have not met with the vets institutions leadership. We have not met with the council. What is going to happen to all these issues that students are raising? And they've been raising it since the time when the fees must fall. And the former president had actually said that there'll be free education, but still it seems that there's no free education that the former president has committed to. We ask you, Honorable Minister, to actually commit yourself as to saying how much are you going to assist our students. Thank you, Chair.
You only have 2 minutes. I've given you another 10 seconds and you just went on and on. Honorable Minister.
Thank you, Chair.
Honorable Chair, thank you very much. It looks like Honorable Numalo has a problem with me than the truth out there. So there's a difference. He's preoccupied of having a problem with me and therefore doesn't know the truth and what is happening. Firstly, I have also expressed my condolence on the member of the public who died this morning. But also don't jump. The matter is being investigated, whether that person was shot or not, and what were the reasons for the death. The media in the morning, they were reporting that it was a student and it's not a student. Now, it's very difficult to answer a question from someone who is all over like we are doing. Every problem that I receive in my department, whether it's an appeal from a parent or from a student, I've got machinery to deal with that. So does NSFAS have all the machinery that I've insisted they need to put into place including appeal processes and mechanisms. I want to challenge Honorable Newman. Don't speak in generalities as a member of parliament. Give me a list of students who are having problems who have not been responded to either by my department or by NSFAS. I can promise you I'll follow that up and I will begin to give you a response in no time. The reason why we are not doing that is because we are grandstanding, saying students are suffering. What do you mean about students? Let me tell you about Wits University now. 95% of all the students who are going to be taken by Wits universities are already registered as I speak now. And you say I'm not in touch with you, Wits University. I'm telling you that because I am in touch with all the universities, not just Wits University, especially at this time of the year. It doesn't mean that there may not be students with a problem, but don't take that problem to mean that everything is haywire and is falling apart. We've got all the processes to deal with all the problems. Letha inkinga mkhatshwa musu kuzokhononda ubuse insizwe encane nekuba ncane njengawe nje letha ngizozilungisa ngoba ngiyazi ukuthi inkinga enjenganalezi zilungiswa kanjani. Ngilala ngivuke ngiphuphe nje ukuxazulula inkinga zabafundi zilethe ngizoyilungisa.
Thank you, Honorable Minister.
The Minister has not responded to the issues that I've raised. He just responded to my comments.
Honorable Nxumalo, you ask a question and the Minister replied to your question. I followed the question that was put initially and the reply of the Minister. And it is my assessment from where I'm sitting that the Minister have replied to your question. You may not like the reply of the Minister, but that is the reply to your question as you put it. You will have another opportunity in days and weeks to come put other questions to the Minister that may cover the areas that has not been covered now. So let us proceed, honorable members. The second supplementary question will be asked by the Honorable Makwacha from the chamber.
Mkhatshwa, Chair, like the former, our colleague there from the IFP, Muhammad, were actually brother and sister because of our clans. Hence, when the minister was speaking to Mkhatshwa, he wasn't speaking to me, but Muhammad. House Chair, allow me to also indicate before asking my question that we note with great sadness the death of a civilian amidst the student protests in Bloemfontein and send our heartfelt condolences to his family. One really hopes that increased stability through access to higher education will be brought to the sector during this registration period. Honorable Minister, I think we can agree that efforts to clarify the miscommunication around this matter must be executed to ensure that society, students, and institutional staff and management, most importantly, are well informed so that they don't continue to be barriers to access to education for our young people, and that the negligence of these institutions is unacceptable because innocent students bear the brunt of their maladministration. And we can agree that we must ensure that what happened to some students in 2020, where they were registered under qualification codes that are outdated, must not happen in the 2021 academic year, because now those students will
Honourable
not be able to
Member,
benefit.
you must now ask the question. Your time is expired.
Chair, sorry, House Chairperson, the question then is, noting these students who are affected by the negligence of the institutions in the year 2020, are there any interventions by NSFAS and the ministry to try and assist these poor students? Thank you so much, House Chairperson.
Thank you. The Honourable Minister.
Thank you very much to Honorable Mkhatshwa. I think firstly, the question, the comment you are making, I agree with. In saying that we are dealing with problems does not mean that there are no problems. That is why we set up these mechanisms to deal with problems. And it's an important issue that we are raising because one of the challenges sometimes that face us is lack of proper sharing of information on time between the National Student Financial Aid Scheme and institution. For example, just to give a quick example, a student goes to register. or has already been told by NSFAS that you qualify for NSFAS and is a continuing student, but the institution sometimes takes long to communicate with NSFAS to say, we are accepting or we have accepted the student, and thereby causing problems. So we've got a number of problems. That's why I have said to NSFAS, you need to now acquire an information capacity that will also enable quicker communication between NSFAS and institutions so that we are able to respond to the needs of our students on time. Now, in relation to the question, already I've begun to answer that we are looking at a capacity of NSFAS itself in terms of information, but also at the same time, we are engaging institutions to make sure that their financial aid offices are able to have enough capacity to be able to deal with the problems that are facing students, whether they are NSFAS students or not. Because if we are able to have institutions responding and acting on time, it always actually assists us to deal with problems. So I am emphasizing NSFAS efficiency as we also emphasize interaction with institutions. The last point is that every year, by the way, we sit down, my department sits down with the registrars of universities so that we are able to work together to ensure that we minimize the kinds of problems that normally arise. Ngiyabonga kakhulu, Sihlalo.
Thank you, Honourable Minister. The third supplementary question will be asked by the Honourable Kwankwa. The Honourable Kwankwa. If the Honourable Member is not available, I will move to the Honourable Boshoff, who is asking the last supplementary question. The Honourable Boshoff.
Honourable Deputy Speaker and Honourable Minister, thank you for the answers so far. NSFAS has a purpose to equip young people for the economy by financing post-school education and training. It is clear why certain legacy qualifications, which have been replaced, are not financed anymore. NSFAS also has, under fiscal pressure, resolved to finance only first degrees, diplomas or certificates, no postgraduate studies. The predicament of jobless graduates is old news. Would it not make more sense to identify occupations rather than qualifications to finance, meaning that all degrees and diplomas required are financed? Thank you, Honourable Deputy.
Did you get the question, Honourable Minister?
I think I did. I hope I did, Chair.
I also hope so.
Yeah, to me as a Tambuza boy, unfortunately, Honourable Boshoff sounds like a radio, a Pelelwe PM10. That's not an attack on you, Honourable Boshoff. Because you are, I can't hear. If I understood you well, the point you made later is an absolutely valid point. That we must not just be looking at undergraduate, but we must also be looking at qualifications. My difference with you is that at occupations is that we must not look at undergrad and just focus on which occupations to support. We must do both, actually. The policy of government says we support students who come from families who are earning not more than 350,000 rands to complete their first undergraduate qualification. Because we don't have enough money, we want to spread it. We don't fund postgraduate. Postgraduate is funded by the National Research Foundation. It's not funded by the National Student Financial Aid Scheme. But besides that, what we had done in the past is that students who wanted to do a second qualification, but in areas of scarce skills, we created a fund which we took from the National Skills Fund to support them. Like we used to support what used to be called BTech, Bachelor of Technology programs, if they were in scarce skills areas like particular fields of engineering and so on. We have done that in the past. But because of the pressure we are under now as NSFAS, we are saying no, we are not going to be funding post-first qualification as the National Student Financial Aid Scheme. So I do agree with you that also looking at occupations, it's something that is very important to do. But we cannot be able to just expand anyhow at the same time into qualifications beyond the first ones, because we will end up disadvantaging those students who do not have even the very first qualification post-school. That has been the logic of the National Student Financial Aid Scheme. But thank you very much for your follow-up question.
Thank you, Honourable Minister. I now want to ascertain if the Honourable Kwankwa is on the virtual platform. The Honourable Kwankwa. It may be a connection issue. That's the reason why the Honourable Member cannot ask the follow-up question. If the Honourable Member is not available, I'm going to give an opportunity to any other party who have not had an opportunity to ask a follow-up question on this question to do so.
NFP.
The DA.
I'm going to recognize the NFP. The DA had an opportunity.
Thank you very much, House Chairperson. Minister, many students are still complaining on the ground. University registration is closing in 2 weeks' time. They're not certain what is going to happen. What can you tell them? How would we be able to do, particularly the first-year students? Thank you.
Thanks very much, Honourable Member. A very important and relevant question at this time. We have eliminated a lot of uncertainty in relation to NSFAS students right now. On Monday, I announced that despite the fiscal challenges that we are having, all NSFAS continuing students who have met the criteria for progression will be supported, all of them. In other words, those who are already in the system in our universities and TVET colleges, they must be registered and NSFAS is going to pay for them. The challenge was with the numbers of new students we can be able to take as a result of the fact that we are having more demands than the resources that are in the hands of government. For a number of reasons. One, it has been the budget cuts, unfortunately, which started before COVID-19. But COVID-19 also contributed to that because we have had to extend the academic year without additional amount of money to beyond 2020 with the 2020 academic year. Then first-year students, the matter has been put before Cabinet, and Cabinet has taken a decision today as to what will happen. Unfortunately, I'm not in the liberty to communicate Cabinet decisions. Cabinet, I'm told, is going to be communicating its decision sometime tomorrow morning as to what will happen. Myself, after Cabinet has communicated, I will also have a briefing with the public in order to give more details and information. But as Minister of Finance said, what is guiding us is that no deserving students who qualify must actually be left out. And that's the policy of government, especially the children of the poor and the working class. Thank you very much.
Thank you, Honourable Minister. Honourable members, I now want to hand over the rest of the presiding of this part of the session to the Honourable Ntombela. Honourable Ntombela, are you on the virtual platform?
Good afternoon, Chair.
Please proceed.
Thank you very much. Honourable members, we now proceed to question number 60, which has been asked by the Honourable P.A. van Staden to the Minister of Health. The Honourable the Minister.
Thank you very much. Thank you very much, Honourable House Chairperson. The question asked by the Honourable van Staden, question number 60, as tabled, I have the following response. 1, with regards to ensuring that the persons allegedly responsible for the fraud and corruption in the Government Employment Medical Scheme, GEMS, are prosecuted, it must be noted that GEMS is an entity that reports to the Minister of the Department of Public Service and Administration, DPSA, and regulated by the Council for Medical Schemes under the provision of the Medical Schemes Act. As part of meeting their regulatory obligations, the CMS, GEMS submitted the forensic investigation report for the alleged fraud and corruption to the CMS. In the submission of the report, GEMS provided with the CMS with the detailed information on action plans that were to be taken against the implicated officials, including disciplinary action for those who are still in the employ of the scheme and other legal action through engagements with law enforcement agencies of the state. The second response is that the administration of the National Health Insurance, NHI, is not going to be outsourced. And hence the claim that GEMS are preferred administrators is far-fetched and premature. The policy position is described in the white paper on the NHI and the NHI bill, which is currently before Parliament. GEMS, like any other stakeholder, will be afforded an opportunity through the parliamentary hearings to present their proposals. There is no consideration of any tender process to appoint an administrator for the NHI fund. Thank you very much.
Thank you very much, Honorable Minister. The first supplementary question will be asked by the Honorable Van Staden.
Thank you, Honorable House Chair. Honorable Minister, there are many allegations of corruption, not only at GEMS, but also within the Department of Health on all levels. An entity such as the NHI is, in our view, a breeding ground for corruption. Minister, whilst your cousin was appointed in the department in 2020, and now a few weeks ago, a tender of the department was awarded to your former spokesperson and private secretary who owns the company Digital Vibes. What assurances can you give South Africa that the funds such as the NHI will not be looted under your watch? Thank you, Honorable House Chair.
Thank you, Honorable Member. The Honorable Minister.
Thank you very much, Honorable Member. The allegations against the Department of Health and various officials will be investigated. They all need to be investigated, even if the allegations are targeting the minister or head of department or any officials. And at the moment, the minister and the department officials are cooperating with the investigation processes. It is true that, therefore, that at any one time, the processes of the allegations that come up have to be reported, and we will continue to ensure that those are investigated. It is not true, though, that there was a cousin appointed in the department, as a member alleges. But also, it is important to say that for the National Health Insurance, we have put up structures that will ensure that there's transparency in the management of the National Health Insurance. There's also, at this point, a public health sector, a health sector anti-corruption platform, from which we have indicated that all the reports that relate to allegations of corruption in the health sector, public or private, have to be tabled at that platform. And this is a platform that will ensure that all the irregularities and corruption are investigated in time so that we can stop corruption. In the NHI, we will make sure that there's no space for corruption. In the NHI, we'll also make sure that the regulations around it allow enough transparency and openness in the management, so that any allegations can be raised even by private citizens or civil society, so that they can be investigated and corruption uprooted. Thank you.
Thank you very much, Honorable Minister. The second supplementary question will be asked by the Honorable Esther Zomo.
Thank you, House Chair.
Honorable members, Minister, at a recent joint parliamentary meeting in February, we were told by the GEMS that criminal and civil processes are underway relating to the recovery of the missing 300 million. Very little detail was provided on what exactly is being done, who is being prosecuted, and what civil litigation, which is apparently exorbitant amount of money. In relating to the civil litigation, which is apparently underway, what specific legal action has been instituted to the recovery of some of this money? Could the minister please provide us with the detail of the action that have been instituted in this regard? And if not, why has there been a delay? Kabazel.
Thank you very much, Honorable House Chairperson and Honorable Member. I do believe that more details are needed about this investigation at the Government Employees Medical Scheme. However, the Government Employee Medical Scheme reports as an entity to the Minister of the Public Service, and therefore more details could be obtained if we approach that minister. We have just been aware that the investigation has been going on. We are not privy to all the details of how far that investigation has gone. We are also aware that some of the issues have been reported to the Council for Medical Schemes, and such investigations have been proceeding, also some of which were under the Council for Medical Schemes, involving some members, and therefore some members of the medical scheme. And so we would only request that such a question be directed to the minister to whom all those details, these details are reported to. Thank you very much.
Thank you all.
So
I'm raising on a point of order.
yes, honorable member.
Yes, when we look at the allocation of the parties here, the last question was supposed to have been asked by the member of the ANC, Dr. S.M. Tomu, but it was asked by the lady there. Can you sort that out, please?
Yes, let's allow Honorable House Chairperson Ntombela. May we allow the Honorable Dlomo, who was supposed to ask the follow-up question before the Honorable Schlengwa, to put that follow-up question now. And then thereafter, we will proceed to the Honorable Temba Kwayo, and that will take care of the question. So it should be the Honorable Dlomo from the ANC. I hope you find that in order, Honorable Ntombela. The Honorable Dlomo.
Honorable Chair, I am actually informed that I'm asking a follow-up question on the next question on Honorable Kwahube. One of my other colleagues who's asking the question is a follow-up. I'm doing on Kwahube.
Okay. That means that the ANC is forfeiting that opportunity for a follow-up question. The Honorable Temba Kwayo.
Thank you, Chair.
The Honorable Temba Kwayo.
Thank you, Chair. Minister, who are the appointed administrators of GEMS, and how much?
Please continue, Honorable Member. Don't get distracted.
Minister, who are the appointed administrators of GEMS, and how much are they paid annually and monthly? Is it true that GEMS is controlled by Johan Rubert-owned Remgro, which have been in control for more than 16 years? Thank you, Chair.
The Honorable Minister.
Thank you very much, Honorable Honorable House Chairperson, as I've indicated, the entity GEMS, as much as it is a health, what's called a medical scheme, the entity reports to the Minister on the Department of Public Service and Administration. And I would therefore request that we redirect the questions to that minister who has got authority to speak on behalf of the administrative issues that relates to GEMS, both in terms of the question of administrator as well as the control of the medical scheme. Thank you very much.
Thank you, Honourable Minister. Honourable Shavambu.
No, thanks, House Chair. I'm concerned because the minister is aware of this question. He's not encountering the questions about GEMS in the House today. He has been aware for some time because these questions are sent prior. The only reasonable and fair thing to do is that when you're going to answer questions, at least familiarize yourself of the details that have got to do with GEMS, because the question was clear from the beginning that it's about the administration of GEMS. What are the issues there? To pass the baton at this time, it's irresponsible, and I don't think that it is an appropriate way of us as Parliament holding the executive to account. It's unacceptable.
Honourable Member, the question that was put by your member is a follow-up question. And it's not the primary question that was asked by the Honourable Van Staden. It's one of those follow-up questions that arise out of that. And the Minister has responded to the question. So if there are any specific details around the subcontracting or whoever is involved in the administration of this process, it would only be fair to put that question as a new question and not expect the Minister, since it involves another ministry, also to respond to that. The Honourable Shavambu.
House Chair, the concern I'm raising is because even in the question that came just before Honourable Thembekwayo asked the question, the Minister took the same posture. And I'm illustrating a simple fact that it is irresponsible for a minister who is going to respond to questions about a specific entity and has not familiarized himself with that. The basic accountability principle could have been to say to the Minister of Public Service and Administration that there is a specific question that is arising out of GEMS. What are the details? What is happening with the entity itself, so that we are able to hold the executive to account instead of passing the baton? I think that still it is irresponsible for the minister to handle the question in the manner that is doing it now.
No, thank you, Honourable Member. Honourable Member, unless the Minister has something else that he wants to add, I want to now go to the rules. And the rules allow you or the member of your party to put an urgent question to the relevant minister, so the relevant minister can respond in detail to that, and that urgent question can be prioritized in the next question session. I'm now informed that the Honourable Dlomo is indeed ready to take the follow-up question. Honourable Dlomo.
Thanks, Honourable House Chair, that I do now have the question that was prepared by Honourable Geller because of the challenges that she faces. Emasontweni amabili edlule ufike uJames Board emhlanganweni wethu bezobika umbiko njengoba befanele balekelelwa i-Council for Medical Schemes Khabazela e-reporter kuwena. Bathi besaxoxa sekuvela engathi kunento zenkohlakalo ekhona endala ekade yaphenywa yile vumbuluka manje, ngoba ke vele uJames yena ngokohlelo lwakhe ureporter ngaphansi kwaMinister uMacingwane, Public Service Administration. Kodwa i-Council for Medical Schemes inakho ukuthi ilethe imbiko kuwe ngale yanto yayikade ibekiwe yokuthi avele lobuqhophololo benze kanjani. Kwaphenywa kudala ukuthi ivumbukelani manje ke okunye lokho. Kodwa leyo report iyakwanelisa yini eyalethwa i-Council for Medical Schemes kuwena ngophenyo abalenza ngenhlangano ngale medical aid scheme ekuthiwa uJames na?
The Honourable Minister.
Siyabonga sihlalo wendlu ngokohlelo lokubambisana kwabongqongqoshe kubalulekile ukuthi singafaki izimpendulo ezingenza ukuthi ngephutha sibike into engesiyo uma umnyango ungaqondene nalowo ngqongqoshe okhulumayo. Kodwa-ke ngokohlelo lomkhandlu ophethe ama-medical scheme bachaza ukuthi kukhona uphenyo abalwenzayo obelibhekene nokuthi kukhona umkhonyovu osoleka ngaphansi komnyango. On the 11th of June, CMS issued a statement announcing establishment of independent investigation panel to conduct an inquiry into allegations. It was named under Section 59 inquiry, and therefore it estimated that there was fraud. The industry estimated fraud of about 22 billion. James fully committed to the investigation, and the James Fraud and Waste and Abuse Policy and Procedures and Practices uses the Board of Healthcare Funders Industry Practicing Number System file to create a healthcare provider record, and it does not contain the issues of data and race. That was the issue. There was a main problem that was raised in relation to the complaints that was associated with GEMS. This report was actually, the investigation was done, and the report that was tabled was brought to our attention, and we were satisfied that enough work had been done in relation to that matter, although it did require that a lot of engagement has to happen with a number of stakeholders. That is the private practitioners who had raised a particular concern. In 2017, there was a High Court application against 2 medical scheme administrators and a number of medical schemes, including GEMS, seeking declaratory relief over the interpretation of Section 59 of the medical schemes. In the application, they contended that the medical scheme interpretation of the section was incorrect, and such interpretation may not be applied when fraud is detected. So we are looking, we are working to follow these reports up, but as far as we would be concerned, the matter has to be handled by the Council for Medical Scheme. So the interim report, in that interim report, it was still a bit of controversy about whether GEMS was informed of that interim report, and they said they didn't have the report. So all of these issues have been tabled to us, and we are continuing to look to look at those particular issues. But we can come back to the committee or Parliament with a whole report in relation to the aspect of the Council for Medical Schemes having reported to us on the matter. But that is slightly different to the issues of the management or administration of GEMS, because that on its own is in the different department. But the report from the Council for Medical Schemes, we can give more details about that if given an opportunity. Thank you very much.
Thank you, Honourable Minister. Tombela, I'll hand over to you.
Okay. Yes. Question number 67 has been asked by the Honourable E.K. Siwela, the Minister of Basic Education. The Honourable Minister.
No, thank you very much, Chair, and also let me acknowledge honourable members in Parliament. Chair, the questions about realignment and rationalization of schools, and our response is that schools are not realigned or rationalized to deal with bad or poor results. Schools are rationalized for different reasons, which have to do with the efficiency of the system, where, for instance, in some instances, you find that schools are just too small and unviable. So you can't deploy resources adequately because those schools are unviable. If you look at the schools, for instance, in Limpopo, which underperformed, those were very small schools where you had 5 matriculants. In some instances, you have schools which have less than 135 learners. So those schools are the ones that we target for rationalization because they are unviable as schools. We are not able to deploy resources properly. But in some instances, you find that there is no need to have 2 schools in the same area it will make sense to consolidate them. If another school has 250, the other one has got 200, the other one has 100. So it makes sense to bring all three of them into one school so that again, you can deploy your resources adequately. So the rationalization has nothing to do with the efficiency of schools, but there are different reasons why we do it. But it's not about performance. Schools that are underperforming, we have a different mechanism of dealing with those, be they big schools or small schools. So, and I agree with the member that it is a very important process that can be complicated. That's a process that should be carefully planned and systematically executed towards ensuring continued universal access by learners to quality education in a rational manner, doing so cost effectively with respect to resource provisioning and resource planning. And that's my response, Chair. Thank you.
Thank you very much, Honorable Minister. The first supplementary question will be asked by the Honorable Siwela.
Thank you, Chairperson, and thank you, Honorable Minister, for the response. How many schools have been impacted by the rationalization policy? And what were the critical factors that necessitated closure of schools affected? Thank you.
Thank you, Honorable Member. Honorable Minister.
Members, well, thousands of schools. I can't give you the exact figure to say, did we have 5,000 schools? For instance, in the Eastern Cape, where they had 6,000 schools and our target was 4,000 schools, already we have rationalized almost 1,000 schools. In Gauteng, for instance, where schools were divided in terms of language groups, where you have in one section, you have a Sotho school, you have a Tswana school, you have a Pedi school, those we have closed. So we can't give you the numbers province by province, but different provinces will have different reasons. So we can consolidate the number as provinces to give it specific numbers. Like in Limpopo, we had to close other farm schools which were unviable. In KZN, we are continuing to close schools which are unviable. But mostly schools that have been targeted are in the Eastern Cape, in Limpopo and KZN, where they have more schools than they need. As a result, it affects their resource allocations. But we can send the reply with specific numbers, because the question didn't indicate that the member will require specific number of schools that we have rationalized, but we have rationalized almost thousands nationally.
Thank you very much, Honorable Minister. The second supplementary question will be asked by the Honorable Pino Tata. Honorable Notata.
Chair, it's Honorable Van der Walt. I will take this question and not Honorable Nudada.
Okay, go ahead, Honorable Member.
Can I go? Yeah, thank you, Minister, for your response. I have to differ a bit because during a national oversight currently, we see that communities are growing. And I think we have to accept and strive that every school in our country must be a school of quality teaching is taking place every day. That will mean that learners will not pass their nearest school and leave behind unviable empty schools because they perceive to be those schools are, first of all, of poor teaching quality, either under-resourced. So where this rationalization is to be taken place, Minister, we know a lot more challenges arise. Can you please ensure us that where learner transport and hostels are needed in many of these cases, it is being provided to the learners and teachers that are affected at the schools they have to leave? If not, how will we do it?
No, Chair, I insist.
Thank you, Honorable Member.
Chair, I insist. The rationalization policy, as it stands, it's for unviable schools, not schools that are underperforming. Of communities growing, that also would have been assessed by the province to say, is this demographically, is it a growing area? I'm giving an example that, for instance, you will find in the townships schools that are based on language groups, and there is no need to keep 5 schools in one community when you can have 3 of them. It makes sense in terms of resources, but it also makes sense in terms of rationalization. In the province where member comes, You have, especially in your farming communities, I'm not sure which community will be growing in those farming communities. You find a school with 75 learners from grade R to 12. It doesn't matter what you can try to put in place, that school is unviable. And those are the schools that are giving, instead, those are the schools that are giving us zeros. They're not giving us zeros because there's poor teaching. They're giving us zeros because they are unviable. So I insist it's not very true. We may differ with the member, but the reasons and the policy on rationalization is not based on the performance of schools, but it's based on the viability of the school, and in most instances, informed by learner numbers, but also informed by the need to consolidate for resource allocation. Thank you,
Thank you,
Chair.
Honourable Minister.
Well, the hostels and
The
transport.
third supplementary question will be, Honourable Member, please just hold your horses. The third supplementary question will be asked by the Honourable Gobo.
Thank you very much, House Chair. I want to start by saying that rationalization of schools result in the rationalization of teachers. Hence this question, which says, given a large number of qualified teachers without the placement positions and those who are unemployed altogether over and above, what has been the plan for the department to address this long-standing problem, and especially with the implication of rationalization, which end up causing a lot of pain and inconvenience to teachers and learners? And these problems end up disruptions in schools, and teaching and learning suffers at the end. May we hear the plans that the minister has. Thank you very much.
Thank you, Honourable Member. Honourable Minister.
Chair, as I said earlier, the purpose of the Education Department is to provide quality education for teachers, for learners. Teachers are employed as a consequence, not as the main objective. Teachers are employed to enable us to provide quality education. So what informs and drives any policy, it's what the learner needs are. And all teachers and like all workers, they follow their jobs. I stay in Cape Town, not because I like, because I have to follow my work. So teachers themselves, and I'm aware it's very painful to be made to follow your jobs, but we can't keep schools which are unviable with 75 kids from grade R to 12, and there are only 3 teachers for that schools allocated, and pretend that we are providing quality education. As I said earlier, if you look at all the schools that gave us zeros, it's schools with 5 matriculants doing different subjects. We can't pretend that you will have 75 children in a farm school from grade R to 12 and pretend that you can give them quality education. But because you want to employ teachers, you keep and kill those kids and get zeros because you have to employ teachers. I've also said, Chair, that it's a process that you do carefully, you organize, but you don't lose your objective, that the objective is quality education, and that's what is going to inform the rationalization, whilst being sensitive indeed to your employees and sensitive to perhaps the learners. But at the end of the day, what is in their interest is quality education, not being at a school which is unviable.
Thank you very much, Honourable Minister. The last supplementary question will be asked by the Honourable Sheikh Imam.
Thank you, House Chairman. Minister, do you not think we're in a state of denial in terms of the quality of education in the country right now, particularly in the rural school? And is that not one of the reasons why parents are not putting their children in these schools, which, according to this report, there are substantial amount of people living in that particular area? And one of the things that comes to mind is the fact that in the first year of tertiary institution, 60% dropout. Added to that is a great percentage of those that start school do not finish school. Is it not because we're not making it into an ideal school, providing sporting activities, extracurricular activities, arts, so that we could develop these learners in different aspects of field. My problem is that the emphasis appears to be on numbers in the school rather than quality. Could you perhaps comment on that, Minister? Thank you.
Thank you, Honorable Member. The Honorable Minister.
Will complete denial and be highly dishonest, pretend that we can provide quality education in an unviable school. Member would know that there's rapid urbanization in the country. People for different reasons are leaving rural areas and coming to urban areas. So it's not because they are chasing quality, it's because kids have to follow their parents. I've given an example of schools that gave us zeros in Zimbabwe. Some of them presented 5 learners, some of them, and they gave us zeros. Schools that have 2,000 in those very rural areas are the schools that gave us 100. So it 100%. So where you can consolidate your resources, you can have the adequate number of teachers, that's familiarize themselves with where we have success, what gives us success. And that's what informs us, not any denial. All we want for our kids is the best. And we know that the best we can get if we can consolidate our resources and we can give quality where resources are consolidated. So to deny the fact that an unviable school can't give you quality education, why would you get into that pretense? I have no reason to pretend that an unviable school, I can throw resources. Why would I throw resources when there are 75 kids from grade R to 12? What resources can you throw there? It's just this, some of the schools are in farm areas, they're unviable. And for the sake of our children, we have to close them and send them to better centers, give them transport. Remember is saying also build boarding schools, but not keep them in areas where we know nothing will come out of it. These unviable schools, nothing can come out of them. Thank you, Chair.
Thank you, Honorable Minister. We now proceed to question number 99, which has been asked by the Honorable S. Bahube to the Minister of Health. The Honorable Minister.
Thank you very much, Honorable House Chairperson. Question number 99 from Honorable Kwahube. The reply is as follows, and may it be noted as well that this question is similar to the question we have answered in number 64. We've made good progress in securing vaccine doses. We've secured 43 million doses in total so far. Our agreement are currently with Johnson & Johnson as well as Pfizer. Although with Pfizer, we still have to sign the detailed agreement. The agreement with Johnson & Johnson is for 11 million doses, and from Pfizer, it will be 20 million doses. In addition, there's a commitment to procure 12 million doses from COVAX. The delivery schedule of the vaccines from Pfizer and Johnson are committed in quarters, not on monthly volume. Doses expected in quarter 1, 2, or 3, and 4. Quarter 1 is 1.1 million. Quarter 2 is 8 million. Quarter 3 is 11.6 million. And quarter 4 is 11 million doses, respectively. We have not received the final delivery schedule of vaccines from COVAX. And in addition, we are in final stages of closing agreements for the balance of the doses required, which would allow us to roll out vaccines according to our plan. We still have on our negotiation more doses, more vaccines that will only be allowed once they are confirmed beyond what we have just indicated at this point. Thank you very much.
Thank you, Honorable Minister. The first supplementary question will be asked by the Honorable Bahube.
Thank you, Chairperson. Minister Mkhize, this House and I think the public can appreciate that the response to COVID-19 is a fluid situation that has required government to readjust its timelines based on foreseeable and unforeseeable circumstances. However, the integrity of the response heavily relies on the political leader at the forefront of this pandemic to be beyond reproach. This is an important thing for a number of reasons. chief among them being the assurance that this process of a vaccine acquisition and rollout is corruption-free. A number of political leaders in the governing party have already been implicated in various corruption scandals related to PPE contracts. Recently, you have been implicated in a dubious contract worth 82 million rand, which is currently under investigation. There are damning allegations against you and your involvement in the awarding of this contract to people who are close associates of yours, which could result in a conflict of interest. Now, considering the serious nature of these allegations and the contract awarded to your friends by your department, would you be prepared to step aside, as per your own party's policy states, for the duration of the SIU investigation to ensure that there is no undue political influence in the process?
I have given you ample time. The Honorable Minister.
Thank you very much. We must then say that the issue of the plan of vaccination rollout plan will remain fluid based on the fact that there are many changing and moving pieces in this regard. We take the allegations of corruption very seriously. And as I've indicated before, there were a number of issues that were brought to my attention by the Director General that required that we should get the investigation going. We then indicated that it was more preferable to get outside investigation or independent investigation, which is going on. And in addition, the SIU has indicated that they will be interested in the investigation. And so we have written to the SIU together with the Director General, and we've cooperated with the process. We have to fight corruption. We will be cooperating with the investigation. And in this regard, we believe that the process is secure enough in the hands of those investigators that no further steps are necessary. And that, of course, we will only deal with the outcome of the investigations when it comes, when it is released. We will also make sure that this is made public so that the whole public is brought to speed in terms of what the latest issues are with that particular investigation. Thank you very much.
Thank you, Honorable Minister. The second supplementary question will be asked by Honorable Keller.
Honorable Ntombela, I've been informed that the supplementary question will be taken by the Honorable Dlomo. The Honorable Dlomo.
In order.
Siyabonga Hlalo. Ngqongqoshe Khabazela. Umnyango wakho manjena wamukela imigomo eminingi ephuma kumazwe amaningi kakhulukazi lo J&J ne-Pfizer. Nizokwenza kanjani ingaphuki le migomo endleleni, hayi nje ukusuka kwayo eIndia iza la, noma nje isusuka eGoli iye eKimberley iye eMqanduli iye eMzimkhulu, ngoba yonke lena futhi inemininingwane ethi idinga amazinga aphansi kakhulu okubanda, ngenxa yokuthi uma kunganakekelanga lokhu kungakhinyabeza kakhulukazi lo mkhankaso wakho omuhle kangaka, izinsuku-ke ekade kubekelwe zona zokuthi uyisebenze kuphela unyaka usuqedile bese ziyakhinyabezeka. Kuzokwenzeka kanjani nikugade konke lokhu ukuze kuyaphela unyaka ngempela abantu izigidi ezama-40 nibagomile eSouth Africa? Siyabonga.
Siyabonga sihlalo wendlu ohloniphekile, sibonge nelunga elihloniphekile ngombuzo. Kunjalo iqiniso lithi le migomo ukufika kwayo inembandela eminingi yokusetshenziswa kwayo, kakhulukazi ukubekwa ngaphansi kwendawo enokubanda okwanele ukuthi ingonakali njengemigomo efanele isebenze emzimbeni womuntu. Ngakho-ke sinezindawo eziningi lapha eNingizimu Afrika esesizitholile lapho kwenziwa khona ucwaningo oluhlukene enamalaboratory akwazi ukuthi agcine imigomo nemithi nezicubo ezithile ngaphansi kwamazinga aphezulu angafika kwizingeni lika -70 degrees Celsius. Ngakho-ke sinazo lezi zindawo ngeke ngathi abangilinganisela izindawo lapho etholakala khona kalula. eBloemfontein nje ikhona, eCape Town kunendawo ezine, eMavundleni, eGrootescuur, eKhayelitsha, naseTas Central. eThekwini kunendawo yaseBotha's Hill, naseChatsworth, naseSphingo, naseTongad, naseVerulam. Bese kuba khona ezinye eseJohannesburg, ezibhedlela zakhona kube khona eseKrugersdorp, eLadysmith, eMamelodi. So zonke lezi ndawo ngokuqinisekiseka kososayensi nochwepheshe ababhekane nohlelo lokucwaninga, lezi ndawo bezivele zinokubambisana nenhlelo eziningi zocwaningo ngendlela eyenza ukuthi kungabe kuphephile ukubeka imigomo kulezo ndawo. So we have a list of laboratories and research centers that have got capacity to store such products at -70 or even other level of temperature, such as some up to 20 degrees, sorry, -20 degrees, -30 degrees. So all of these have been assured that there are adequate facilities for this, taking the fact that the distribution won't happen in a lump sum. The numbers will be such that these can be accommodated right across the country to make sure that the cold chain preservation is secured. Thank you very much.
Thank you very much, Honorable Minister. And the third supplementary question will be asked by the Honorable S.S. Tembekwayo.
Honorable House Chairperson, I've also been informed that this supplementary question will be taken by the Honorable Shavambu.
In order.
Thank you very much, House Chairperson. So on the 24th of February, the Minister of Finance said that we are allocating 10 billion rand for the purchase and delivery of vaccines over the next 2 years. When we asked him a question in the committees that deal with finances here, as to just how many people can you vaccinate with 10 billion rand over 2 years, he did not respond to that question. But now giving you that question, how many people can you vaccinate with 10 billion rands? Because he kept on saying here, but hesitantly, that you're going to vaccinate the population that is needed for herd immunity before the end of this year. But the budget says that it must be over a period of 2 years in terms of the allocation of the budget. How many people, I'm sure there's a model now that we can be able to quantify how many people are you going to vaccinate with 10 billion rands? Because already you have started with the purchases, you have already committed the numbers that speak to the vaccine rollout program. Let's deal with that question succinctly.
Thank you, Honorable Member. Honorable Minister.
Thank you very much, Honorable House Chairperson and Honorable Shivambu, for the question. At the moment, we have signed an agreement and ordered about 11 million doses from Johnson & Johnson and 20 million doses from Pfizer. Those two together at this point come to 7.6 million rand, 7.6 billion rand. And if you look at those together, they will vaccinate about 21 million people. Then another 2 billion rand has been committed to COVAX to give us an additional 12 million vaccines. That will give us another 6 million. So together, that will give us about 27 million people to be vaccinated. If we note that 11 million will be a single dose, and then the other 20 plus 12, which is 32, will be responsible for 16 million people if you do 2 doses. So the total, therefore, will come to about 27 million people of what we have ordered. If you take again into account the amount that has been, those that would have been vaccinated by the end of this current phase on the health workers, it could come to about 500,000, which means it's 27.5. And then, of course, the rest of the others who are all going to be on the Pfizer dose vaccines will actually be part of the additional amount that I've just mentioned. So all in all, with the amount that is committed at this point, we should be able to get about 27.5 million people vaccinated, which means 11 million single dose and the others will be double dose. Thank you.
Thank you very much, Honorable Minister. The last supplementary question.
On a point of order, can we please then note, I know we're going to deal with the budget later on. What the minister has just illustrated now is that what National Treasury has allocated for vaccination is not going to achieve herd immunity. Because 27 million vaccinations is not herd immunity. Your herd immunity is 43 million in terms of your own estimations, if not 40 million. It means there's already in terms of you achieving herd immunity. You're misleading us.
Honorable Shivambu.
This process.
Honorable Shivambu, it would not be proper to allow a debate on this matter. The minister has given you the best he can in terms of the answer. There are procedures to follow if one is not happy about that. We now go to the last supplementary question, which will be asked by the Honorable F.M. Swartz.
Thank you, House Chair. Honorable Minister, arising from the response and in particular the issue of the 10 billion rand that is to be allocated for the purpose of rolling out vaccinations over 2 years, I'm sure you'll agree that this is rich pickings for unscrupulous people. And you did indicate steps that you will be taken to address the present scandals in the health department and that the SIU has been involved in that regard. However, it does seem that the Health Sector Anti-Corruption Forum is ineffective. Will you, Honourable Minister, take steps to ensure that corruption does not take place with that 10 billion rand and at the very least ensure that real-time auditing takes place with the expenditure of the distribution contracts? Thank you.
Thank you very much, Honourable Member. The Honourable Minister.
Thank you very much, Honourable House Chairperson. Let me say that we have given the concrete answer in relation to what is committed in relation to the acquisition of vaccines. The Minister of Finance has also indicated that there are contingency reserve funds that would be looking at other various needs of that the country will face. That matter between myself and the Minister of Finance is such that we will not have any problem dealing with the orders that are necessary for purposes of procuring the vaccines. We have the anti-corruption forum on the health sector, which is actually housing very competent leaders of the NPA, of the police, the Hawks, the SIU, and various departments, so that there is a short-circuiting of any delays in the process of investigations. We have no reason to believe that such a body is not effective. We have already had the SAPs already indicating that they've been able to get hold of fake vaccines where they were reported. Insofar as the procurement process, we are ensuring that there's a very tight management between Treasury and Health in the acquisition of the vaccines, so that there is no malfeasance at that level. We have an interministerial committee that has got a work stream that's focusing on the issues of prevention of corruption. That's led by the Deputy President, and this will also make sure that the accountability, the management of the entire process is free of corruption. If there is any corruption, there is already a mechanism to report so that we can act on it. So I can really assure the honorable members of parliament that everything has been put in place to avoid any situation of malfeasance, irregularities, and any form of corruption. So with that, we believe that we have learned from the previous lessons from the last year in the PPE situation. So we will make sure that this is handled with the utmost integrity, as I've indicated on all the structures that are informed, that are a part of this process. Thank you very much.
Thank you, Minister. We now proceed to question number 59, which has been asked by the Honorable Mishwe, the Minister of Human Settlement, Water and Sanitation. The Honorable Minister.
Thank you very much, House Chair. House Chair, I would like to thank Honorable Meshwe for asking the question because it's a very topical matter that we're trying to deal with. It's been a crisis for this country for about 10 years or so. Finally, we have been given a report by the Human Rights Commission, which allows us to take on the responsibility with more powers given to us. The Human Rights Commission started investigating the issue of the Vaal some 4 years ago, maybe even more, and has been in touch with us on a regular basis to tell us about the crisis in the Vaal. We have been aware of the crisis in the Vaal, and we have been visiting the Vaal and trying to solve the problem. However, the report of the Human Rights Commission comes as a relief to us because it empowers us to do what we need to do. It gives us the responsibility to enforce Section 63 over the Vaal and therefore take over the responsibility of all the things that will happen in the Vaal so that we are able to do what needs to be done, which is to solve the problem of the Vaal. House Chair, the report of the Human Rights Commission has been met with mixed feelings. The local municipality is not too happy with us taking the powers given to us by Section 63, but we are elated because it gives us the responsibility fully to do what needs to be done. We received the report 2 weeks ago. I have since written a letter and sent the report to Minister of COGTA so that I can get her concurrence in taking over the responsibilities that were otherwise under a municipality. And I have since written to the Premier to indicate to him that this is what we're going to do. We have put together a team from my office, and we have conducted extensive studies of what it is that has caused what we have in the Vaal. And what we have discovered is absolutely amazing, but it also allows us the possibility to resolve the problem that needs to be resolved. With the support that we hope to get from Parliament, with the support that we hope to get from Treasury. You will remember that the first intervention in the Vaal was proclaimed by the Minister of Finance, and he requested the Defence Force to go in there and clean up the Vaal. The problem in the Vaal is not the Vaal itself, but everything else that flows from Mpumalanga, Free State, Northwest, and all the other areas flowing into the Vaal. The problem in the Vaal is that it was not intended to cater for what it is catering for. The problem in the Vaal is that there has been a whole build-up around that area of human settlements with informal settlements, with all the sanitation flowing into a dam that was not ready for that. And everything that could go wrong has gone wrong at the Vaal. And we are glad to take over with the support of the Human Rights Commission. We hope we have the support of Parliament. We will be tabling this before Parliament because we will be requesting additional resources to be able to clean up the Vaal.
Thank you very much, Honorable Minister. Honorable members, if the Honorable Rotor is ready, I'd like to hand over to her, but I will call the first supplementary question for Mr. That will be asked by the Honorable Mishra.
Thank you, Chairperson, and thank you, Honorable Minister, for your reply. It is encouraging to hear that you are looking with excitement to deal with that problem that has been plaguing that area for many years. For those who are not aware, raw sewage has been flowing into the Vaal River from pump stations in the Mfuleni municipality for many years now, posing environmental and health risks to communities that include Vereeniging, Sebokeng, Boipatong, and Sharpeville. What I want to know is that, Honorable Minister, as the Defence Force managed to fix about 3 primary treatment tanks out of 39, when will the rest of the pumps be repaired so that the affected communities will not be condemned to live under the appalling and unhealthy conditions for the rest of their lives? I thought the environmental study you spoke about was done by the SANDF. If it was not satisfactory, can you enlighten us why you are going to do that again when the SANDF they did it already? Thank you, Chairperson.
Thank you very much, Reverend Meshwe. No, the Defence Force did not do the kind of environmental study that would help us resolve the problem. The Defence Force was called in almost on an emergency basis to clean up the Vaal, and that is what they have done. We have since put together a team of people who are going to put together the whole all the studies that have been done in that area. The problems did not start with either my term or my predecessor's term or the previous predecessor. It has always been a problem. The dam was built in 1903. 1903 to service the burgeoning industries around mining towns, to service the burgeoning Afrikaner, predominantly poor Afrikaner farming around the Vaal. And since then it has become several areas put together. But the dam itself, with all of that which is required for rectification, has not been upgraded. We have concluded a study now, and we intend to take it to Cabinet. We will share it with Parliament. We will be asking Rand Water to be our responsible entity over the Vaal. We will be creating employment for the people of the Vaal. We will be dealing with this matter with the business community of the Vaal, because they have been complaining and their businesses have suffered quite a lot. So we have begun to create an environment where it is possible for us to bring in everybody who is able to assist us But the environmental study will be available and will be made available to the portfolio committee. And it consists of the study of the Human Rights Commission, various other studies that have been conducted. It consists of the history of the Vaal, which was never intended to do what it is doing now. So we are continuing with we're continuing.
The Honorable Minister, your time for response on that first follow-up is expired. We now go to the Honorable Sifai. Thank you, Chairperson. To the Honorable Minister, what is the department doing to ensure it addresses challenges of sewage, field, and pollution to the rivers, understanding the health and the ecological impact of such waste? Thank you very much, Honorable Chair. The Honorable the Minister.
Well, we share the responsibility that the Honorable Minister is asking about with the Minister of Environmental Study of Environment, and very soon we should have concluded a pact to work together. In the past, there used to be under. Could I be protected, Chair? In the past, there used to be a cohort of young people called Battalion Working for Water. We're hoping we can have something of that nature, to have people around the river who will be employed to clean up the river and keep the river clean. Over and above that, we intend to ensure that all municipalities who are responsible for waterworks and providing potable water to their municipalities, taking it from the river, are responsible for keeping the rivers clean. What we will be doing now as we solve the problem of the Vaal will be a prototype of what we will expect of every major river in the country.
Ra leboga mme. Potšišo ya go tlaleletša e latelang e tla botšišwa ke Mmamhlala. Honorable Mhlala.
Honorable Minister, one of the most chilling findings of the Human Rights Commission is that both the department responsible for human settlements and the Mfuleni local municipality have allowed people to live under deteriorating conditions for years. Of course, the situation is the same for many communities across the country. In your view, Minister, is your department woefully out of touch with the challenges faced by people such as the community of Mfuleni municipality? If not, why have you allowed the situation to deteriorate to this level? Thank you.
Before you respond, Minister, may I ask Honorable Suwela to please mute. We don't want conversations. Mr. Honorable Suwela, Elvis, please mute your mic. The Honorable the Minister.
The deterioration of our rivers has been going on for a very long time, and it is a consequence of an unplanned migration into towns, the setting up of informal settlements, and lack of proper skills to maintain our rivers, etc. It has been happening over a whole period of time. The Human Rights Commission indicates in its report that it started looking into this matter at the end of 2016, and by 2018, they had decided that they're going to take action, and they have finally taken action. So it is a systemic rather than a personal or a departmental matter. But out of this, we have now the necessary instrument to take over the responsibility of these dams and rivers, which we did not have naturally in the Department of Human Settlement of Water and Sanitation, and we want to use them to effect, and we want to collaborate with all the other departments that have a hand to that might give a hand to help: environmental affairs, cooperative governance, and any other department that has a technology that will assist us to clean up our rivers, to find a way in which we can teach our people, maybe now that we have Minister Angie Motshekga here, teach our people how to keep our rivers clean, because basically water is a very scarce resource in South Africa. The only water we have is the only water we will ever have, and we need to keep it clean. But our people need to be educated. We're going to have partnerships, I hope, also with radio stations to indicate what we should do to keep our rivers clean. When you look at what we have found in the Vaal Dam, it is carcasses of horses, carcasses of all sorts of things that have been slaughtered there. We find pampers, baby pampers. We find old furniture thrown into the river. For our people, it's just a waste basket. We need to improve the education and sensitivity around that which is essential for us. Thank you.
Thank you, Minister Akbara Groenewald. This is geleentheid nou.
Thank you, Honourable Minister. This is true that polluted water of the Vaal River is costing the taxpayers more money because it costs more to clean it up. Yet, when we had a blue drop and a green drop report, this could have actually been, avoided by earlier detection. Your department last said that they will employ that green drop and blue drop again. From you, I want to hear when will that become reality. Thank you.
The Honourable the Minister.
Honourable Basson, the matter of the Vaal goes back several years. The matter of the Vaal started with your ancestors who were farming there and didn't look after the water. It's just gone worse. So it has nothing to do with the green drop, blue drop, which we committed ourselves to last year. But I take the point that you're making, that that would improve the situation greatly, but it is not, in essence, anything that will solve the problem of the Vaal. The problem of the Vaal will be solved when all of us work together and understand the value of our dams, the value of our rivers, and the fact that we do not have the amount of water that will keep us afloat. We are a very dry country. If we save water, we look after water, all of us, without blue drop or green drop, it just must be part of our consciousness. Let us look after water because we're a dry country. Let us look after water because our future generations will need it. So casting, doubt over capacity here and there will not help. We need you too to teach your community what needs to be done. We need everybody to be concerned. The Vaal Dam is 100 and something years old, and it is now no longer able to cope with what has been thrown into it. Out of 44 pumps that should be working, only 2 are working, gradually just grinding to a halt. And the fact that it has been in the hands of a municipality that has been under administration did not help. So it is in our hands now. You are in the portfolio committee. We're talking to members of parliament. We will need everybody to put their hand on the wheel and make sure that we succeed. We have to succeed because we need that water. We need clean water. We need to keep our dams working. And I'm glad that I had this opportunity to appeal to all of you. Our dams need protection. Our people need to know that they cannot throw everything into the river. Our people need to know we're a very dry country. Thank you very much, Chairperson.
Thank you, Honorable Minister. And that, honorable members, says that the time allocated for questions has expired. Outstanding replies received will be printed on the Hansard. I'm going to ask the secretary to read the order of the day.
Consideration of 2021 fiscal framework and revenue proposals and of report of Standing Committee on Finance thereon.
Thank you. We'll now invite the Honorable Maswanganye.
Get out of here.
Honorable Maswanganye on the virtual platform.
Thank you, Chairperson. Aka swiro swa huvo yo endla milawu ya Republic ra Afrika-Dzonga va holobye ndzi khensa nkarhi lowu ndzi nga nyikiwa wona ku andlala xiviko xa komiti ya timali hi mayelano na mpimanyeto wa lembe ximali ra 2021. The Minister of Finance, Mr. Tito Mboweni, tabled the 2021 budget before the Parliament on 24th February 2021 in line with Section 27 of PFMA and Section 7, Subsection 1 of Money Bills Amendment Procedure and Related Matters Act, called Money Bills Act. The Minister, together with the Deputy Minister, the DG and officials from National Treasury, briefed the Standing Committee on Finance, Select Committees on Finance, Standing Committee and Select Committees on Appropriations on 25th February 2021. The committees received a post-budget tabling input from the PBO and the FFC. The Minister drew attention of members to the budget highlights, emphasizing that the budget supports, among other things, economic development, social services, which constitute about 56% of the total budget, and political party funding. in response to the advice asked about solutions to the persistently poor economic performance, given the role and responsibility of National Treasury as the custodian of economic policy. The Minister gave explanation on factors that are influencing economic growth. On economic outlook, the 2021 budget review highlighted that economic decline in 2020 was as a result of effects of COVID-19 pandemic and structural constraints to growth. National Treasury expects real GDP growth of 3.3% in 2021 from contraction of 7.2% in 2020, moderating to 2.2% in 2022 and 1.9% in 2023. GDP growth will be driven by a rebound of household consumption to 2.9% in 2021, despite an expected decline in investment from an estimated 18.4% in 2020 to 2.4% in 2021. There is a concern about unemployment, Chairperson, which is rising. The 2020 fourth quarter labor force survey from Stats SA shows that the number of employed persons increased by 333,000, while the number of unemployed persons also increased by 701,000. The rate of unemployment measured 32.5%, the highest record since the start of the labor force survey in 2008. Compared to a year ago, total employment decreased by 1.4 million. National Treasury added that the labor market effects emanating from COVID-19 are particularly severe for low-skilled workers in high-risk occupations and are deepening existing inequalities across the age, education, gender, and race. There is also a concern about the debt to GDP ratio. Gross loan debt is now expected to increase from 3.95 trillion rand or 80.3% of GDP in 2020-21 to 5.23 trillion rand or 87.3% of GDP by 2023-2024. National Treasury expects the proposed fiscal framework to stabilize debt at 88.9% of GDP in 2025-2026. Debt service costs will rise from 232.9 billion rand in 2020-21 to 338.6 billion rand in 2023-24, now consuming 19.2% of tax revenue. This is a serious concern, Honorable Chairperson. We received submissions from the stakeholders in terms of parliamentary procedure that there should be public participation. Subsequent to that, we invited National Treasury to come and respond to submissions from the public. As a committee, we are making the following observations and recommendations. The committee remains concerned about that despite government's efforts to support job creation, the rate of unemployment reached a record level in last quarter of 2020, making it extremely difficult for the economy to absorb a new entrance into the labor market, particularly the youth. We note National Treasury's decision to remove the VCC incentive, which was aimed at, amongst other things, job creation. We recommend that National Treasury should regularly review other incentives intended to support economic growth, create jobs, and support SMEs, such as the employment tax incentive, to determine the extent to which these programs are achieving intended policy objectives and report progress to the committee. The committee also notes some progress made in implementing reforms aimed at addressing structural constraints to growth. We still urge for a speedy implementation of economic reforms and for government to create a conducive environment for the economy to thrive, create jobs, and encourage investment over time, reduce heavy reliance on social services. As indicated in the previous reports, we believe that reindustrialization and localization should become key pillars of our national reconstruction and inclusive economic recovery strategy, and that there needs to be a buy local campaign for the state, private sector, and consumers in general. On fiscal policy issues, the committee notes with concern that the budget deficit has now reached a double-digit record level and has doubled since February 2020 budget in response to the spending and economic pressures of COVID-19 pandemic. The committee therefore recommends that National Treasury should provide the committee with regular reports of progress made in reducing budget deficit. The committee also observed, as I've said before, that the debt to GDP ratio remains very high. We recommend that the Minister of Finance reports quarterly on the effectiveness of Treasury's debt management strategies that will ensure that the level of debt stabilizes over the medium term and avoids a sovereign debt crisis. Also, the committee reiterates its recommendation in regard to the issue raised by the minister on the zero-based budgeting. It's a matter that the minister has mooted last year, July. The committee requires the minister and National Treasury to do this briefing at the next quarterly meeting as to whether government has adopted this strategy of zero-rate budgeting or is something that is being looked as an option. So we'll await the minister's briefing in this regard. The committee also raised issues in regard to the collection of revenue. Therefore, the committee recommends that SARS should intensify revenue enhancement initiative to collect maximum revenue due to government in order to enable it to deliver on its constitutional obligations. Amongst other things, SARS and the law enforcement agencies should attack those who are involved in the illicit economic activities. Moving towards conclusion, Honorable Chairperson, the committee recommends that the public procurement bill be brought to Parliament as soon as possible. We don't agree with Treasury when they say that they are going to table the bill in December 2021. It's long that this bill has been sent to the public for comment. As soon as this bill comes, the better, because it will serve the previously disadvantaged women, youth, and people living with disabilities. We don't agree with the explanation that the bill will be tabled in December. While recognizing the economic, financial, and other challenges, the committee recommends that in view of COVID-related job losses, increasing poverty and inequality, the National Treasury and government should seriously consider the basic income grant after the necessary consultation with the relevant stakeholders. However, we would like to refer this matter to our sister committee, that is the Appropriations Committee, which can give further attention to this matter. In conclusion, having considered the 2021 fiscal framework and revenue proposals, the Standing Committee on Finance requires the House to approve the 2021 fiscal framework as presented with the above recommendations. I therefore move for the adoption of this report. Nakensa Mtsamashtu Inko.
Nakensa Mchavsek. The Honorable Hill Lewis.
Thank you very much, Chairperson Barroso. Colleagues, today we are debating the fiscal framework, which is distinct from the budget. The fiscal framework sets out the pillars of borrowing, taxing, and spending, which underpin the budget. The budget sets out the detail of how those assumptions of spending, taxing, and borrowing will be spent by each department and government function. So later on, when we debate the budget, we in the DA will take serious issue with the spending priorities and choices that this government has made inside the budget. Some of which we believe are simply unjust and unfairly prejudiced the poor in favor of more bailouts for state-owned companies. But that is not the topic of today's debate. Today we are debating the big picture, the fiscal framework. And we must say that on the big picture, on the fiscal framework, the Minister of Finance should be congratulated for getting a few big things absolutely right. Firstly, he has committed to get debt under control by 2025 at 88.9% of GDP. He has committed to bring down the public wage bill by a whopping 300 billion rand over the medium term. And he has sent an important signal, a symbolic gesture that South Africa's success will be built on business success by pledging to lower tax on companies next year. These are the big things. And without them, our public finances simply would not be sustainable for much longer. As always, we've heard much sound and fury in debate the last week about the idea of austerity. I'm afraid that those shouting austerity about this budget simply haven't read the document. Even with the efforts that the minister has announced in this budget to control debt and the wage bill, we will still be borrowing 540 billion rand this year, nearly 2 billion rand a day. Last year, we borrowed more than 770 billion rand on top of what we raise in tax. Nor do those people shouting austerity fully grasp the devastating impact of ever-increasing debt service costs on services to the poor. So when you hear for someone calling for more borrowing this year, as I'm sure the Honorable Shivambu is about to do, then please understand this. What they are also calling for is lower services and fewer services for the poor next year. That is the cost of more borrowing now, less money to spend later. Every rand of borrowed spending now is paid for with more than 1 rand of foregone spending later. That is a basic law, and it does no good to deny it with voodoo economics, which argue that you can just keep spending and borrowing without any care or worry for the consequences. A government cannot borrow these enormous amounts year after year ad infinitum. Profligacy eventually catches up with you, and that is exactly what has happened in South Africa. So we welcome the minister's fresh commitments to hold the line on fiscal discipline. Of course, we have heard these commitments before from the minister. We all remember the speech last year with all of its biblical language about the so-called active scenario, which committed the government to the narrow path to salvation. It is vital now that for South Africa's economic salvation, the minister continues to walk up that path, no matter how rocky or steep it becomes. That is why this is the perfect opportunity for us to adopt a legislative fiscal anchor in South Africa. What is a fiscal anchor? It provides legal limits on how much government can borrow each year. That means that for whichever party is in government, for all of time, politicians who are in charge of the budget will not be tempted to borrow a little bit more than we can afford each year, until such time as it becomes totally unsustainable. That is why I have tabled a fiscal responsibility bill, B5 of 2020, which I really hope that the minister and his colleagues here will support when we present it in committee next Tuesday. We are very pleased, or we were very pleased, to hear the Minister explicitly refer to fiscal rules. And the Treasury, in its presentation to our committee last week, explicitly endorsed the idea of new fiscal rules for South Africa. This is great news. Going back as far as his first budget as Minister, he explicitly endorsed the idea of fiscal rules. Our bill provides for a fiscal rule prescribing that debt expressed as a percentage of GDP must not be more than it was in the previous year, that government guarantees must not go up year after year, and that in crises like we had last year, the National Treasury can apply for exemptions from this rule. We have an opportunity now, Minister, to set South Africa on a path of fiscal responsibility. We must not turn away from this chance. The benefits for our society will be felt by our children and felt in particular by those who rely on the state to deliver basic services every day. Our responsibility to the most vulnerable in society requires a fiscal rule in legislation in South Africa. Now is the moment. Thank you.
Thank you, Honorable Lewis. The Honorable Shibambo, let's just allow this service staff to do their work.
No, thank you very much, House Chair. We take this opportunity as the economic freedom fighters to condemn the police brutality that is displayed by the ANC government against Wits University students, and condemn the fact that the ANC government once again killed the black person in Johannesburg as part of suppressing a legitimate protest against financial exclusion. If the austerity budget that we're debating here did not reduce the allocations to the National Students Financial Aid Scheme, the black person who was killed today would have never been killed, will still be alive as we speak here. We stand here to propose that we as Parliament will reject the austerity budget and fiscal framework as presented by the Minister of Finance on the 24th of February 2021. We do so just even now for a simple reason. There's not enough allocation for the procurement and delivery of vaccines. We're in a crisis now. In his response to the questions that were being asked now, the Minister of Health has admitted to the fact that 10 billion rands over a period of 2 years is inadequate to reach herd immunity, to achieve herd immunity. And you cannot say that you're going to depend on contingency budget, because contingency budgets have got their own rules and guidelines. And contingency budgets are meant for unexpected eventualities. We have been expecting this year that we should vaccinate at least 67% of South Africa's population. So the budget has to be allocated to achieve that. It's a basic logic that we have to then follow. So we must use our power as Parliament. We are allowed as Parliament to amend money bills. We can't introduce them, but we can amend them. But let's amend the allocation to give adequate resources for the vaccination of our people so that we insulate them from the disease that is devastating not only South Africa, but the entire world. That is a basic thing that we need to then deal with in terms of what happens. Now, DA will not know, maybe because of the semi-literacy levels on economics, that unlike in a household context, when you are faced with a fiscal crisis as a country, you do not reduce expenditure, because national expenditure is national income as well. Government expenditure amounts to GDP growth later on, which will contribute to a reduction of poverty, creation of jobs, and increased heightened economic activity. It contributes to broadening the revenue base. The only sensible scientific way to deal with the debt to GDP ratio is to increase economic activity. There's no shortcut to that. There's no other way you can reduce the debt obligations Because if you do not expand as government, the economy is going to shrink. Even the government component that deals with the economic growth is going to shrink, and therefore automatically increasing the debt to GDP ratio. It's called the ratio because it's comparative in that particular context. But the budget in the MTEF, as proposed, is going to reduce national expenditure by more than 60 billion in the 2021-2022 budget, by more than 90 billion in the 2022-2023 budget, by more than 150 billion in the 2023-2024 budget. What that automatically means is that the economy is going to be shrunk by government deliberately because of a misconception of how budgeting and fiscal policy can be utilized to reignite economic activity. I know that there was discussion in the committees on finance that we should have further deliberations in that particular regard. But there are issues that we have to then deal with, at least in this year, in terms of what should happen. We should finalize the establishment of the state bank. There's an agreement in terms of us establishing a state-owned bank. There's lots of benefits that come with that. We should finalize the discontinuation of private ownership in the South African Reserve Bank. We should, as we committed, all of us here, that we should establish a sovereign wealth fund in terms of what should happen. But we should guarantee energy security. And let us dismiss an illusion, the nonsensical illusion, that we can achieve energy, particularly electricity security, without the base load of clean coal. There's no renewable energy sources that is going to be a reliable source of energy in the manner that it is here. So a mixed energy policy in South Africa that must be pursued should include clean coal, must include the liquefied natural gases, must include nuclear, and it must of course include renewable energies, which must be anchored by state ownership and guidance. But in the manner in which it is being dealt with now, we're not going to achieve anything. Worse, the budget has reduced allocation to the Department of Trade and Industry, which is supposed to deal with the micro components of the economy in terms of driving and subsidizing industries. How is the economy going to grow if you're not paying particular attention to industrialization? We have illustrated several times and will continue to do so, to illustrate that you will never be rich as a country, you will never create jobs unless if you deliberately and purposefully pursue industrial expansion. The current budget, as has been presented, has reduced the allocation to industrial policy, meaning that the economy is going to shrink, and it's going to shrink the revenue base, meaning that poverty is going to deepen, unemployment is going to widen, and inequality is going to widen, and we're not going to achieve anything. Let's reject this budget, it's not helping us. Thank you very much.
Thank you, Honorable Shivambu. The Honorable Leslie IFP.
Thank you very much, House Chairperson. The Minister's address to this House on the budget and economic forecast for our country was to some extent measured, considering the fact that our state of our economy and devastating effects of COVID-19 had on our country. The IFP welcomed the 11 billion injection into Presidential Youth Employment Fund and the further 4 billion into local and rural enterprise. This speaks direct to unemployment, particularly young people, and it will ignite some economic activities in rural areas. The government forecast on infrastructure development is well received by the IFP. However, we're very concerned, House Chair, by the aging infrastructure which has been neglected and has not been serviced over many years. We can't shy away from this opening statement which spoke about hope. That signal that things are not really looking good. The absence of the alloferox in the House this time around sent a clear message that it has eventually died. The IFP warned the Minister that it's not the amount of water that sustains the plant, that which makes it resilient, but the properties of the alloferox which enables it to survive. With that being said, and much like the alloferox, we should stop, Honorable Chair, pouring money into SOEs, but rather bring people with right qualities and qualification to do the job and turn things around in our ailing entities. We must deal once and for all decisively without fear or favor with the growing and deepening rot that is in the system. By the rot, I mean corruption, inefficiencies, and redundancy that is there. We all want our economy and our country to thrive, not only to survive. For how long are we going to waste money on SOEs where there is no single indicator that they will ever recover or pull themselves out of the debt? We had the increase in grants, which was exciting to hear, Honorable Chair. But the truth of the matter is that 10 rands here and 10 rands there won't make a difference to the poor people. Honorable Chairperson, the ever-ballooning public sector wage bill is a serious point for our country. We're in this crisis because government has essentially become the biggest employment agency. We are faced with the collapse of efficacy and efficiency in our department because of care deployment that has gone far too long. In all spheres of government, the creation of posts which are non-existing is used to reward friends and comrades of those in the ruling party. These corrupt and unethical activities from those who hold high offices has costed our country billions, so much so that we are unable to reduce the debt and our budget has become a debt servicing plan. Therefore, Honorable House Chairperson and Honorable Members, for the sake of putting our country first, I ask you today to heed the advice of the IP, sell all SOEs or bring a private partner to all of them across the board. Heed the advice of the IFP caucus leader, Prince Mosuk Telezi, by helping people to help themselves. Give people a hand up for life, not handouts that are temporary and not sustainable. Uma sihloniphekile, labo abadla imali abangamankentshane kuhulumeni bengakaphenywa batholwe benamacala, injobo ilingana umtsinsila, asikuphinde silibonise lethu liphakama kule ndawo elikuyo. Siyabonga kakhulu. I-IFP iyayisupporta i-report.
Thokoza Mhlonishwa. Honorable Vice Honorable Ngumar and others. Let me say this, I won't say it again. If you press that mic, you must be able to raise a point of order. If you don't raise a point of order and you press the mic, it is unparliamentary because no one has given you the permission to speak. So if you do that, you will be warned, and the next time you do it, you will be removed from the platform. Thank you. Honorable Vessels.
Thank you, House Chairperson. House Chair, the skepticism of rating agencies about if the minister will meet the targets he announced is understandable. The fiscal framework is based on sustained improved revenue collection. If that does not occur, the fiscal framework will not realize, and the budget that it's based on will also fail. Chairperson, revenue collection can only occur if there is economic growth. The fiscal framework is also based on the successful containment of the public wage bill, where no cost of living increases will be enacted. Will this be possible? Last year, during the supplementary budget, the minister announced with much fanfare, as usually, that zero-based budgeting will be utilized and we will move towards zero-based budgeting. Yet now, the ruling party is unsure if this is government policy. Chairperson, nothing will realize if the ANC's ideology, the union's power are still going to be allowed, because then the wage bill will not be contained. Then economic growth will not take place because of failed ANC policies, which is making economic growth impossible. We heard today, Chairperson, that there's insufficient funding to actually fund the vaccine program. So it's yet another unrealistic plan and a pipe dream. Eskom debt, Chairperson, is one of our biggest threats. 488 billion rand is owed to creditors, whilst municipalities owe Eskom more than 40 billion rand. Whilst municipalities owe water boards more than 10 billion rand. Whilst government departments owe municipalities more than 15 billion rand. Government is a pyramid scheme. There's no doubt about it, because there are certain benefactors, but those benefactors are people like Jacob Zuma, Ace Magashule, ANC cadres, and all your friends. But the biggest losers are the people investing in this scheme, and those are the taxpayers, investing their hard-earned taxpayers' money, their hard-earned income in a failed pyramid scheme, which is collapsing. This welfare state is unsustainable. The commitment to control debt will fail if the economy is not stimulated. And I agree with the Honorable Shabamba that economic growth is needed. But what he must understand is economic growth will not take place whilst private sector is vilified. We need to create a conducive environment for private sector to create employment, to spend money, to invest and create employment. We welcome, Chairperson, the commitment of tax cuts on corporate income. Governments should earn tax, not own. Die goue gans, voorsitter, is moeg goue ganse gelê. Meer en meer gemeenskappe neem dienste oor van die regering faal om dienste te lewer. Daardie mense lewer nou self dienste, so hulle gaan nie betaal daarvoor nie. Dis nie 'n dreigement nie, minister, dit is die realiteit. Ons het dienslewering nodig, ons het infrastruktuur nodig en ons het 'n verantwoordelike regering nodig wat nie besig is met 'n piramiedskema wat ons geld skuld en totaal en al korrup en geld wanbestee, en daarom sal hierdie fiskale raamwerk val. Ek dank u.
Thank you. Thank you. The Honorable Swart.
Thank you, House Chair. House Chair, the ACDP welcomes the recent economic bounce back in the last quarter of 2020, which resulted in October's dismal tax collection shortfall figures being revised downwards by an estimated 100 billion. Now, the budget deficit for 2020 is still, however, estimated to be a massive 689 billion or 14% of GDP. When one then has regard to the fiscal framework going forward, it becomes clear that any tax windfall must be largely used to reduce the spiraling public debt and debt service costs, which are crowding out much needed expenditure on health, education, and crime prevention. As other speakers indicated, gross loan debt is to increase from 3.95 trillion rand to a staggering 5.2 trillion rand in the outer years. And clearly, a strict fiscal consolidation path is necessary. The proposed fiscal framework aims to stabilize debt at 88.9% of GDP by 25-26. Now, debt service costs will rise from 232.9 billion in 2021 to 338.6 billion in 23-24. That's 19.2% of tax revenue. That's 1 rand in every 5 rands collected will be spent on debt service costs, which is indeed a very serious situation. Whilst this past month's announcements on the fiscal framework is somewhat better than previously thought, there are still significant risks to National Treasury's economic growth projections. If these projections, together with planned cuts in government expenditure, do not materialize, then the fiscal consolidation path required to stabilize public debt levels will not materialize. Let's look at some of the risks. Include new waves of COVID-19 infections, ongoing load shedding, rising public debt, additional credit rating downgrades. And when one considers these risks, the 2021 GDP growth projection of 3.3% appears rather optimistic, that given the sharp contraction of 7% in GDP. However, as far as revenue proposals are concerned, the ACDP welcomes the withdrawal of 40 billion rand increases in taxes over the medium term and the adjustment of tax brackets for inflation. Enhancing SARS capacity is also to be welcomed, as this bodes well for the collection of taxes going forward. Lastly, the Minister must hold the line on expenditure. We need good stewardship of our resources to avoid spiraling debt and a sovereign debt crisis. I thank you, House Chair.
Thank you, Honorable Swart. I've got no name for the UDM. Are they maybe in the platform? No. The ATM? No. The Honorable August? Good.
Honorable Chairperson, when the COVID disaster hit, intelligent people around the world said we mustn't waste the crisis. From the depths of our misery, new opportunities would arise. The challenge was recognizing the opportunities and working out how to draw advantage from them. In South Africa, the COVID crisis was layered on deeper systemic crises. Our economy was already on its knees. The gap in living standards between rich and poor was already a gaping chasm. Our basic education system and our municipalities were already failing to equip our children and families with the basic tools and environments to escape the cycles of poverty, gender exclusion, violence, and underdevelopment. We knew we'd had to borrow more. The question was how much and how would we afford to pay it all back? Then the pandemic struck. Chairperson, the pandemic has forced us to recalibrate our sights and objectives. We can't prioritize creating new business, jobs, and infrastructure if we don't prioritize paying to vaccinate the nation first. With our vaccination program now underway, we can start to look towards the economic U-turn. We can start to refocus on bringing stability to our fiscal framework. We don't want to return to the economy of the past, which excluded the majority of our people from meaningful opportunities. We want to use this opportunity to create something new. In this context, Good welcomes the announcement of a 792 billion to expand infrastructure as a key driver to job creation, stimulating the economy, and addressing the infrastructure backlog. Good also welcomes the extension of the TERS grant until end April. But it is not enough. We must use this period to intensify our support for the most marginalized of our people. We cannot afford or avoid a basic income grant any longer. No person can live without an income. We therefore expect the Minister of Finance to be leading the urgent debate about timeframes and quantums for the introduction of a permanent BIG. Eskom's troubles must be urgently addressed. Failing SOEs like Eskom and SAA stop investment and economic certainty dead in their tracks. But even as we perform miracles, we cannot afford to defocus from our priority to reduce debt. Zero-based budgeting is a good place to start. Good calls on all government departments and all provincial and local governments to commence with a zero-based budgeting process in the next financial year. To identify waste and fund priorities. I thank you.
Thank you. Honorable Hill Lewis, please. Let's observe. Please. Those. Honorable Sheikh Imam.
Thank you, House Chair. Let me start off by saying we all accept and understand that we have reduced revenue. We're sitting in a crisis in terms of debt in the country, which is going to increase considerably for 338 billion just in debt service costs, or 5.2 trillion in debt. Now the minister, and I'm not sure whether the Minister of Finance is in conflict with cabinet, because he says one thing and government is doing something else. He talks about reducing the wage bill. I'm not sure how he's going to do it. He talks about reducing debt, which we like, but I can't see how he's going to do it. Because remember, even the monies that you borrow, those monies that you borrow are not being used for economic growth or development in the country, but a very great percentage of these monies are being used for The public service wage bill, 650 billion rand. And if you look at the 650 billion rand that you spend in this country in the public sector wage bill, the question that you need to ask, are we getting value for money? Clearly we're not. Now, so that's the other problem. I like the idea of the minister talking about cutting taxes for business. But there is more to businesses being successful in South Africa. The cost of doing business, the demands from labor unions. These are some of the matters that we need to address. And very importantly, a lot of emphasis appears to be on infrastructure development. But what we're forgetting about is, do we have the capacity to implement those infrastructure programs? Clearly we don't, because over a period of time, we could see that there's underspending. And the reason for that is because of the lack of capacity in many of these departments. Now, it's very well and good to say we're going to introduce a basic income grant. We've had the TERS grant. We've had the 350 rand grant. We said free education. But where is the money going to come from? Do you want to make South Africa into a socially dependent state, or do we want to create a conducive environment for businesses to thrive so that people can earn an income? Because I can tell you now, it's just a matter of time. If we go the route we are going, we'll have no monies to pay grants, we'll have no monies to pay pension, we'll have no monies to pay staff, which is what is happening in Amatola in the Eastern Cape already. So let us also not make people dependent, but let's create that conducive environment. All rural towns and municipalities should learn to start making themselves self-sufficient and take investment and development into the areas, not rely on the national fiscus for revenue. They should not be doing that. So if we continue to borrow, I can tell you we're going to reach a fiscal cliff in South Africa. I think we need to change the way we're conducting ourselves if we want to create a better environment and introduce.
Thank you very much.
Thank you very much. The NFP will support it. Thank you.
Thank you. The Honorable Mabiletsa from the ANC. Thank you.
Thobela ka moka kwa gae. Ka mo Honorable House Chairperson, Honorable Ministers and Deputy Ministers, and Honorable Members. I want to start by welcoming the committee report introduced by the Chairperson. As we consider the fiscal framework and revenue proposal, we must not lose sight of our immense responsibility. Our responsibility is to nurture a project started by generations of women, such as Mama Charlotte Maxeke, whose singular mission was to bring to birth a new democratic, non-racial, non-sexist, and prosperous South African nation, united in our diversity. As the elected representatives of the people, we cannot let our country down when our people are looking up to us to restore hope that this nation will rise again. In the words of the founding president of our democratic South Africa, in his inauguration speech in 1994, open quote, "The sun shall never set on so glorious a human achievement," close quote. Indeed, the economic and fiscal outlook of our country is bleak. However, as the ANC, we support the efforts of the National Treasury and South African Revenue Service to ensure that our country does not descend into a debt prison. If we do, we will lose our sovereignty. Contrary to what some had predicted, government did not increase tax. Yes, government did not increase tax at this stage, as this could impact on the already slow economic growth. Despite there not being substantive tax hikes, SARS has ensured that committee that there will be room to improve the efficiency of collection. The lowering of corporate income tax to 27% has been welcomed by business. with the substantial subsidies and exemption afforded to various sectors in the economy. We believe that there should be enough incentives for long-term investment and growth, particularly in the manufacturing sector. As the ANC, we are confident that with the 3 billion additional allocation for the acquisition of critical skills at SARS, deepening the capability for artificial intelligence machine learning, expanding and increasing the use of data, and also building the entity's technology platform will enhance the collection revenue. South Africa's public purse is already reaping the benefit of the turnaround efforts at SARS over the past couple of years, with improved implants contributing over 100 billion in the current fiscal year. We have noted the submissions by organizations from civil society, including COSATU, representing the organized working class, Budget Justice Coalition, SAICA, OUTA, and many other patriotic South Africans. Honorable Chairperson, these South Africans have expressed their views on possible tax increases for wealthy and high-income individuals and companies, as well as exercise duties, an increase in health promotion levy, capacitating SARS to deal with tax and custom evasion, illicit trade in tobacco products, and many other constructive ideas. We want to ensure civil society organizations that this is your parliament and that the ANC has heard you. As we ask this House to accept the fiscal framework and revenue proposal, we call on SARS to focus on collecting tax on non-compliant individuals and companies. We welcome the fact that over the past 6 years, government has introduced numerous measures to increase the tax paid by those with large incomes and the wealthy. However, we believe that fundamentally we need to expand the tax base and improve the collection and administrative capability at SARS. This will ensure that government has more space to keep true to its commitments to the South African people. But, honorable members, we must work together to defeat the demon of corruption, and we must do so in the 6th administration. We have learned with dismay the level of corruption and tax evasion in the PPE procurement saga. SARS has already collected close to 175 million of taxes from companies who sought to defraud the system. The oversight work of all our committees must increasingly focus on the inefficiencies in government spending and closing the loopholes of corrupt procurement practices that still persist. We must be unapologetic and speak out to the executive and accounting officers in the various government departments that the quality of spending of public funds directly impacts on the tax morality of South Africans. The poor construction and maintenance of roads, quality of water and service, and frontline public servants makes many citizens skeptical to comply with our tax laws. This has a direct impact on the ability of SARS to perform. If we can guarantee the delivery of quality roads, hospitals, education, and other public services, we can justify with confidence the need to raise taxes. As the ANC has resolved, our challenge is to build a capable, ethical, and developmental state. We have to achieve this objective in honor of those who let down their lives for a democratic South Africa.
Ra leboga, Mama Biletsa. I just want to confirm if these parties are not participating. AIC? No. COPE? No. PAC? Thank you. Honorable Hendricks Aljama.
Thank you very much, Honorable Chair. Honorable Chair, I know the President talks about smart cities but Al-Jamaa would like to talk and position South Africa as a smart country. Fiscal framework for a smart country must embrace the fourth industrial revolution, an interest-free state bank, a digital currency backed up with a Mandela gold coin, all governed by what is called the new abnormal. Interest-free banking is freeing up latent entrepreneurial talent to ride this lion of change towards upliftment and fiscal freedom. In so changing a disadvantage into an advantage, it's no longer unemployed youth or unemployed graduates. It's about a large source of educated labor who are tech-savvy, ready to do business anywhere in Africa and beyond, how by an interest-free state bank. An interest-free state banking system as a new abnormal will make the aspiring entrepreneurs and those growing their business to rediscover banking against the underpinning principles of fair play, equitable sharing of wealth, earned from legitimate growth of the capital, and consistent with the new value of professionalism as espoused by the Honorable President Cyril Ramaphosa. The governing party in South Africa has been abuzz for many years about a state bank. Al-Jamaa is still willing to assist with establishing an interest-free state bank, even if we have to submit the private members' bill, which will be a lifeline for young South Africans saddled with a legacy of debt, the interest component each year, which will soon be equal to its income revenue. I hope this revolutionary thinking, embracing the new abnormal, will capture the imagination of all South Africans towards an interest-free South Africa, an interest-free Africa, an African solution to dramatically push the African Renaissance. Al-Jamaa already sees signs of its foundational principles for the fiscal framework in the equity provisions of the special fund to help Black women take over the tourism industry in South Africa. Al-Jamaa supports this report, Honorable House Chair.
Thank you, Honorable Hendricks. The Honorable Dr. George, good day.
Thank you, Chairperson. The Minister has said that we owe a lot of people a lot of money. Our gross loan debt will increase to 5.2 trillion rand in 23-24. The fiscal framework is a projection reliant on assumptions made about GDP growth, income, and expenditure. GDP projections over the past 10 years have been overstated because government's incoherent economic policy consistently failed to generate economic growth. Government remains trapped in its failed ideological belief that it can create economic growth and generate jobs. The numbers don't lie. Our economy was already stagnating and shedding jobs well before the pandemic arrived on our shores. COVID-19 revealed how vulnerable we always were to a fiscal shock, particularly one of this magnitude. The pandemic did not cause the fiscal crisis we face now. It accelerated it and made decisive action on reform more urgent. It is not too late to implement the reforms our economy desperately needs. All we need is sufficient political will for this to happen.
I was busy in Parliament.
We either try a radical socialist experiment that will fail and drive our society even further into poverty, or we can implement the reform needed to break the cycle of unemployment and poverty. This can happen if government enables small business and entrepreneurs to thrive in a conducive environment. The only way to increase GDP is to stimulate more economic activity. The developmental state is clearly unable to do this because it is incompetent and riddled with corruption. It is designed to enrich a few at the expense of everyone else. Without reform, our economy will not grow. Income is unpredictable because there is no certainty on growth. We agree that there is no space for tax increases, and increasing pressure on the already small tax base drives taxpayers away. The increase in the fuel levy is a stealth tax that will dampen economic activity by increasing the cost of doing business. The only way to increase income significantly is to make it easier for business to operate. Without reform, income will not increase. As the cost of interest on debt keeps rising, more and more spending on service delivery gets crowded out. The most vulnerable members of our society bear the brunt of this burden. Social spending is declining while the need is increasing. This should be the other way around. Governments across the world have stepped up to the plate to provide additional support as the pandemic ravages lives and economies. Our government strangles economic activity and offers close to nothing in return. Instead, it focuses on pouring billions more into a hopelessly bankrupt airline and cannot bring itself to reduce expenditure on millionaire managers in the public sector who add no value and feast while the people starve. It is necessary for government to spend additionally on protective equipment and vaccines that were not anticipated a year ago. This has become an opportunity for corrupt, politically connected cronies to steal whatever they are able to get their sticky fingers on. Without reform, expenditure will not be brought under control. Without reform that lifts GDP growth and subsequent tax revenue, the numbers on the fiscal framework remain assumptions that won't be achieved. Bold and decisive reform action is required. If debt continues to pile up and interest payments crowd out more and more service, the downward spiral will gather momentum exponentially. In finance, hope is not a strategy. Yes, Minister, we owe a lot of people a lot of money. And unless you drive the reform we need, you will owe a lot of apologies to a lot of people when they don't get paid. Thank you, Chairperson.
Thank you, Honorable George. The Honorable Abraham, the ANC.
Thank you very much, Honorable House Chair. I greet the Chief Whip of the Majority Party and all the members in the House. Not surprisingly, once more, we notice the ANC that the self-proclaimed party of the left, the EFF, and right-wing FF+, have both agreed to reject the budget. The question is, should millions of South Africans starve due to ideological differences? In considering the fiscal framework proposals as tabled in the 2021 budget, it would be important to remind ourselves that the budget is an instrument of expression of government policy. Therefore, any debate should assess whether the policy prescriptions that the executive has to perform against are reflected in the fiscal and revenue proposals and reflect policy that will address the needs of masses of our people and not the interests of influential sectoral lobby groups, a problem that all governments face and threaten the policy integrity of a governing party. The 2021 budget is premised on 4 main areas: fighting corruption, fighting the COVID-19 pandemic, economic recovery reforms, and the constitutional obligations that the Republic has. So, choices have to be made informed by what the Constitution mandates the executive to progressively realize and by the ANC's election manifesto mandate. In addition to this, we have the injunction of the Constitution, oversight in the budget, in which Parliament must satisfy itself whether what is in the fiscal framework and revenue proposals addresses the policy mandate and addresses the needs of our people, in particular the poor. The ANC, in considering the fiscal framework proposals, makes the following points. The revised growth outlook over the MTE is not surprisingly on the upward trend through 2021 and 2023. The important point to make is that we will only be back to the 2019 levels by the first quarter of 2023, meaning that we should not expect, because of the projected 3.3 growth of 2021, that the economy is suddenly back in shape. Economies respond far more slowly, something opposition parties are politically and conveniently blind to. What is important in this regard is that National Development Plan requires for any meaningful change to be abject levels of unemployment, poverty, and inequality to change a growth of 6%. To progressively achieve this, we have macroeconomic policy and the economic plan, which Parliament through oversight must assess. In addition, all major private sector undertakings require our closest scrutiny. Government commits to levels of capital expenditure so as to facilitate, among others, private sector investment. We should be able to assess whether such commitments are commensurate with the desired outcome. The fiscal outlook is better than was predicted during the October MTBPS. And as we argued, the fiscal cliff scenario is not borne out by facts. A close examination both of the budget review and submissions on the budget show the economy clawing back and reducing the deficit over the MTEF. Whilst large and persistent increases in budget deficits result in higher debt service costs and compromise the sustainability of public finances, the mechanisms to deal with this are not to be found in the prescriptions of most opposition parties. The slash and burn approach will deepen poverty. Their slash and burn approach will deepen poverty, raise inequality, and increase unemployment. Rather, the solution lies in government stimulating the demand side of the economy, the private sector responding to this, and consumption side of the economic growth, increasing revenue, creating jobs, and producing a more virtuous cycle. It can only be those who have wealth in this house, who don't suffer the daily humiliation of being economically poor, that can choose to come to this podium and present prescriptions that are modeled to increase the revenue of vested interests. The ANC has clearly stated that fiscal and monetary policy need to be far more mutually reinforcing if we are to reach the NDP level of 6%, at which level a marked reverse of unemployment, poverty, and inequality will be seen. As outlined in the budget review, fiscal policy continues to focus on short-term economic support, fiscal consolidation, and debt stabilization. This, during the public hearings, fiscal consolidation came under a lot of criticism. Not surprisingly, we need to look far more closely at the evidence and what this tells us. What this says is that amendments to the Money Bills Procedures and Related Matters Act did not go far enough. We are expected to receive a budget on the 24th February, do a thorough analysis, and then present a report within 14 days and claim to have done justice to the fiscal revenue proposals. This approach produces two extreme poles. On the one hand, the fiscal cliff makes more cuts and deals with the labor aristocracy. Austerity pole, neither of which is helpful. For the opposition, those who regret and those who call for more cuts and even state we need austerity are taking us nowhere either. The truth lies more in having time to examine options based on validated economic research, more time to question proposals for Parliament to engage. Each year, in answer to questions that are raised to the National Treasury, we always commit to the phrase, we need to talk, and it does not happen. The two finance committees need to give both the Parliamentary Budget Office and FFC a set of terms of reference of research that will require to be done in advance of major events in the budgetary cycle, and this should include this inform and improve our and make Parliament less dependent upon what others say, but more informed by evidence and impact assessment of the fiscal framework and revenue proposals in relation to government policy. In conclusion, Honorable House Chair, on the balance of available evidence and the limited time at our disposal to assess this evidence and appreciating that we need to do things differently going forward, the ANC supports the report. Thank you.
Thank you, Honorable Abraham. We now invite the Minister of Finance, Honorable Mboweni, on the virtual platform.
House Chair, I'm sorry, I'm in Johannesburg and the network is not that good. I hope you can hear me very well.
If you anticipate that, you must just switch off your video.
Okay.
Yes.
But you can see me now.
Yes, we can.
Oh,
But
He can switch off his video. We have no respect for Black lives. He can switch it off.
Honorable Ntlangwini, Honorable Ntlangwini, Honorable Ntlangwini, you do that again, you'll be removed. Please don't do that. Honorable, please proceed.
Thank you very much, House Chair. I need to start off by, thanking the honorable members who are in the House, who throughout this COVID crisis have come to the House and given our House the dignity it deserves. And you personally, House Chair, you have been through with us during this thing, this difficulty. And I really, really want to express my appreciation to you and those members of the House from the different aisles of the House for really keeping our democracy alive and for being in the House in Cape Town. I apologize that I'm not in the House to provide this response to the debate. But I really thank you for the opportunity. Secondly, let me thank the chairperson of the committee and the whole committee for the work they've done. People don't appreciate the work that we do. A huge amount of documentation is provided, and they plow through it, and they analyze it, and they understand it, and they request from the National Treasury any additional information. This is a huge amount of work, which I must say I appreciate the chair and the committee for the work that they've done. Having said all of that, let me respond to a few issues. I don't want to take your time on this, and because you've been sitting for a long time. But if I was to pose the question before all of us as leaders of South Africa, in between 1910 and 1933, the industrialization program in South Africa began. What was key in that process? What was key, amongst others, was the formation of something called ISCOR. And that was based on the iron ore and so on that was there in South Africa. And the first plant of ISCOR was in Pretoria West. And that was, kind of like the industrialization phase of South Africa, 1910 to 1933. So I think banking and finance also developed along the way. The key issue for me, as your servant of the people, is in 2021, what is it that we can do that will surpass the initial industrialization phase of South Africa in 1910? It's a key question. And members of parliament, I think, honorable members, we should deal with that. And I submit, Madam Chairperson, that faced with the fourth industrial revolution questions, which Honorable Hendricks has raised, we then have to answer the question, what is it that we can do now to answer the question about the fourth industrial revolution? And I think the budget that has been submitted before you seeks, amongst other things, to answer that question. It's a very deep theoretical, political, and programmatic issue that we must face. And I, as Minister of Finance, would want to participate in creating something for South Africans that answers the question. If in 1910, the industrialization process began in South Africa, in 2021, what are you going to do that will advance the interests of South Africans and take this country forward? And I think the committee, under the leadership of Honorable Maswanganyi, has tried to give us pointers about what we should be focusing on, the fundamental issues. Forget the political differences and so on. What should we do? I accept, for example, a number of points being offered by the DA because they're in the national interest, and we must take that on board. Finally, let me deal with the following issues. The state bank that Honorable Hendricks raises is a really fundamental political, economic, and financial issue for this country. I know, I returned to the cabinet from the private sector. During my time, about 10 years or so in the private sector, I raised a number of projects and I approached most, if not all, financial institutions in the country to support me. They did not. And the explanations were clearly not post-apartheid. So the issue of the state bank is not an ideological issue. It's a matter that we must deal with. And so the state bank has to be created. And in my view, the African Bank offers us a platform to create the state bank at the moment because, basically the PIC, the Reserve Bank, and so on, they own about 50% of the African Bank. That offers us a platform to create a state bank, and that's necessary. But that bank must operate on business principles, but also understanding where our people come from. We really have to support our people to get the economic system to grow. So I leave the state bank there for now. And then there was an issue about the wage bill that was raised, I don't know, by Honorable, I don't know. So I think we must be very careful about how we discuss the issue about the wage bill. There are many public servants in South Africa who play an important role, and we must appreciate their role. Honorable. So I think we must appreciate the role that our public servants are playing and so on, and handle the matter about the wage bill very carefully, and so that we come to an understanding amongst ourselves about how to deal with that. So let's not politicize it. Let's handle it very carefully and discuss it in a calm manner in order to advance our country. As far as fiscal rules are concerned, which is what the DA has raised, they are raising a very important point. But again, let's discuss it. Let's not be ideological about it. And let's see what is it that we can do in managing our fiscal position in the country. And let's not politicize it. Let this not be a DA matter or an ANC matter, but what is a national responsibility that we should pursue. On zero-based budgeting, we are all together, we agree, and we must pursue at that point. Cabinet has agreed on it, and the National Treasury is pursuing the matter. Already, the Department of the Public Enterprises and the National Treasury are being used as the guinea pigs of zero-based budgeting. And I can promise you that come next year's budget, this matter is going to be dealt with very seriously. On the basic income grant, honorable members, Madam Chairperson, we need a full discussion on this and full research whether we are in a position to afford it or not. But let's be realistic. Many of our people are poor. And as a caring government, we need to respond to this question in a manner that assists our people to find work, to do something productive, and also what is financially sustainable. My advice to all of you, don't take decisions which in future you might be unable to sustain. But our people are poor, and we must respond to them and the poverty that they find themselves in. Then there's an issue about the budget deficit. And again, once again, let me thank the committee for the work they've done and the understanding which they have of the difficulties that we confront. But you know, when there's a difficulty, South Africans always rise to the occasion from all parties, including the Freedom Front. And even the EFF, when difficulties arise, all of us come together. So I really thank you for agreeing that we must stabilize the deficit, stabilize the debt, and not pile up difficulties for the future generations. As far as the procurement bill is concerned, I have...
If you can wrap up.
Yeah, I'm finishing off now. As far as the procurement bill is concerned that the committee has raised, I can assure honorable members that I've asked DG Dondo, DG of the National Treasury, to speed up the procurement bill so that it comes to Parliament this year and be finalized. And Madam Chair, thank you very much for affording me the opportunity to respond. And I thank all members from all political parties for your support. Thank you very much.
Thank you, Honorable.
We have not said anything, Minister. Nothing.
Honorable Honorable Mautwe, please, we don't do that. And you don't have to respond, Honorable Semenya, because you know it's unparliamentary to do that. Please don't do that, guys. Chief Whip, what do we do with the report?
Thank you very much, House Chair. House Chair, I move that this report be adopted by this House. Thank you.
Thank you very much. The motion is that the report be adopted. Are there any objections?
Yes, Honorable Chairperson. The FF Plus calls for a division. Thank you.
A division has having been called, the bells will be rung for 5 minutes.
We are waiting for them.
Chair, can you give us at least a minute?
Okay.
They coming through regularly now. One stop. I think 8 minutes.
Qhamela ngcono ucishe ikhamera naku sikubona ukuthi uhambaphi.
Come again? Oh. Okay. This is for more numbers. Well, I hope they send. I'll put up 50 now, 10 now, 22, 22. Yeah, whatever is the latest we use. Yeah, that's the latest. The 10 now. If they send anything after that, they will use that. Yeah, also. People maybe asking to log on now, but I don't think they would know. If they're asked to log on now, and you get different numbers because it still has 50 seconds. nothing identical. If there's no users, yeah. And it's not going to be.
Thank you, honorable members. I want to believe that all the whips in the house are ready with their numbers. Honorable members, the Speaker has determined that in accordance with the rules, a manual voting procedure will be used for this division. Firstly, in order to establish the quorum, I would request the table to confirm that we have the requisite number of members physically present in the chamber and on the virtual platform to take the decision. The party whips will then be given an opportunity to confirm the number of their members present and indicate if they vote for or against the question. A member, any member, who wishes to abstain or vote against the party vote may do so by informing the chair. Are we all ready? As we will be requesting those numbers, we would also want to ask ICT to work with us and make sure that the numbers that are given by parties correspond with what they have. Do we have a quorum? Do we have a quorum? Okay. Okay. We have confirmed that we have a requisite quorum, so we'll proceed. The question before the House is that the consideration of 2021 fiscal framework and revenue proposals and a report of Standing Committee on Finance be agreed to. The voting will now commence in the way that I have explained, and we will start with the ANC. Honorable Chief Whip of the ANC, of the Majority Party.
Thank you very much, House Chair. House Chair, ANC physical here in the National Assembly Chamber is 30. ANC on the virtual platform is 140, totaling up to 170. We are voting in full support. Thank you.
Thank you. The DA?
Thank you, Chairperson. The Democratic Alliance has 59 online, 11 in the House, totaling 70, and we vote in support.
Thank you. EFF? The EFF?
House Chair.
Yes, proceed, ma.
We have 24 on virtual platform and 7 on physical, and we vote against. Thank you.
Thank you very much. You are correct, there are 7. No, members, don't do that.
I know where my members is, House Chair. I know.
Thank you
I'm
very
in
much.
control.
Thank you very much. IFP?
Thank you, Chairperson. The IFP has 11 on virtual, and we vote in favor of the report. Thank you.
Thank you. FF Plus?
Honorable Chairperson, we have 5 on the virtual platform, 4 in the House, total of 9 voting against.
Thank you. ACGP?
Thank you, House Chair. We have 2 on virtual, 1 in the House, and we vote in favor. Thank you.
Thank you. UDM? They're not on the platform. The ATM? Not in the platform. Good. Good, you were here, you participated. Are you gone now? They're gone. Thank you. NFP?
Thank you, House Chairperson. The National Freedom Party has one in the House and in support. Thank you.
Thank you. The AIC of Hope of PAC of Al-Jama.
Al-Jama has one and virtual, and we support the report. Thank you very much, Honorable House Chair.
Thank you, Honorable Hendricks. We will now, maybe let me ask, is there any member that wishes to abstain or vote differently to their party? None, thank you. The voting session is now closed. Thank you very much. Honorable members, we don't have any abstentions. We have 40 noes and 256 ayes. So that says the report has been agreed to. Honorable members, before we close, I just want to thank ICT for the delivery on their promise that we won't have any glitches today and going forward. And I want to urge the chief whips and whips of this house. Tomorrow we have caucuses. Can we just remind our members that even if you are at home, please keep your mics off, because even if you don't talk, they can detect any type of commotion or noise that is happening where you are, and it disturbs us. Please do this in your caucuses. Having said that, that concludes the business of the day, and the House is adjourned. Thank you.
Long live Mebu Rato, long live!
Long live!